signing interpreters who can take 3 minutes. With that, welcome Senator King.
Thank you, Mr. Chair, members of the committee. You know, I've been here a really long time, and I was just sitting here thinking, I don't remember ever spending as much time or effort and staff hours as I have on this bill, so I hope it's a good one for you today. Mr. Chairman and members of the committee, despite having one of the largest populations of deaf and hard of hearing residents in the country, Maryland is one of the very few states in the country that does not require licensing or standards for sign language interpreters. This has resulted in, at times, devastating effects for deaf and hard of hearing individuals in our state, especially in medical and legal settings. After several years and many, many hours of outreach, inclusion, and compromise, we have Senate Bill 748, which will set the framework for sign language interpreters to meet certain standards and become licensed. I am offering one amendment to this legislation that removes the criminal penalty and conforms the bill to the House cross-file. Deaf and hard of hearing individuals in Maryland deserve protections from unqualified or fraudulent interpreters, and so I respectfully request a favorable report on Senate Bill 748 with amendments. Mr. Chairman, my sponsored panel has been working very hard over many years on this legislation, and will be able to give you their firsthand experiences on the very urgent need for this legislation. So if you wouldn't mind, I'll bring my panel up.
Absolutely. We have Stephanie Summers, I believe, is in your first panel. Mark Burke and Leslie Puzio. Does my list match
Yes.
your list?
Mm-hmm.
Okay.
And can I just say, Mr. Chairman, your staff has been phenomenal working with us on this, and I just want to thank them for that.
Thank you. Ms. Summers, I think you're first person.
Hello, Chair Pinsky and Madam Vice Chair Kagan, as well as members of the Education, Health, and Environmental Affairs Committee. Good afternoon. I'd like to introduce myself. My name is Stephanie Summers, and I am representing the Maryland Sign Language Interpreter team under the Maryland Association of the Deaf. I am here to testify in favor of Senate Bill 748 with amendments. We have been collaborating and brainstorming with a variety of different stakeholder groups throughout our community to create this bill, to protect our deaf consumers and citizens, as well as protect our interpreters and the caliber of their profession. As you know, in 1990, the Americans with Disabilities Act was codified into law, and that required businesses to provide any business that provides general service to provide qualified interpreters. Now, unfortunately, without either federal or state definitions as to what qualification means, there was none. And therefore, today, we see interpreters working in high-stakes situations and causing undue harm to the deaf community. Many of you might have seen this in real time in 2017. On the news during Hurricane Irma in Florida, they had a signer, a hearing person, trying to convey information, and basically he warned the public about an advancing monster bear pizza instead of a hurricane. And therefore, deaf individuals who didn't have access to that information remained in harm's way. This is a real-time example of the harm that is caused every day in the state of Maryland on our college campuses, in our courts, in our hospitals, in doctors' offices, and on job interviews. This bill at its heart is a consumer protection bill. This would not only license interpreters in the state of Maryland. There are provisions also within this bill to establish regulations for agencies, because there are agencies that do practice disreputable types of behaviors. For example, not giving the interpreter all the information they need to be able to judge as to whether or not they are qualified for an assignment. Of course, the interpreter then bears the brunt of that penalty without agency regulation. That being said, agencies certainly would have a seat at the table in developing those regulations so their voices would be heard with the licensure board and the stakeholders at large. This bill would also not create a shortage of qualified interpreters. There is no data, empirical or otherwise, to support that. There are provisions and language within this bill requiring the establishment of programs and workshops to support and train interpreters in obtaining licensure, particularly those interpreters who come from historically marginalized communities. The purpose of this bill is just to cull those interpreters who continue to work unqualified and do harm. There are approximately 699 certified interpreters in the DMV area. In addition to that, there are many, many uncertified interpreters who would be able to apply for a provisional license under the bill as written. You will notice that there's no grandfather clause within this bill for those who have been interpreting for many years, frankly, because many of them are the reason and the impetus for this bill's inception. Those who are skilled can obtain a license through one of three mechanisms, the majority of which will be licensed by virtue of the fact that they have a national or regional certification. For those who are unable to sit for those types of testing, the board will establish criteria to allow those folks to demonstrate minimum qualifications to obtain licensure. Here in the state of Maryland, we have many, many businesses who are already following best practices as outlined in the bill. There are a lot of reputable interpreting agencies that only hire certified interpreters or interpreters that meet a minimum standard of qualifications. Those agencies support the spirit of what we are proposing. Many businesses will have the additional benefit of not having the burden of having to evaluate and try to find qualified interpreters themselves. Today, you will hear from Mr. Mark Burke, who is the owner of Streetcar 82 Brewery. And he will illustrate the need of hiring qualified interpreters from a business perspective. Thank you.
Thank you very much. Ms. Summers, who's going to go next?
That would be me. Thank you, Chair Pinsky, and thank you, Madam Vice Chair, for the opportunity to be with you this afternoon. I'd like to introduce myself. My name is Mark Burke. I'm the owner of Streetcar 82 Brewing Company, located in Hyattstown, Maryland. Okay, we've been in business since
Hyattsville.
Hyattsville. Our business is very unique in the sense that we are a deaf-owned and deaf-operated brewery. I am here in favor of Senate Bill 0748, and I want to speak a little bit as to why. This bill is important because it establishes expectations for qualified interpreters working in the state of Maryland, and it also will assist agencies throughout Maryland to help basically eliminate the poor practices and deceptive practices that many operate under when it comes to hiring interpreters. As a business owner, this is mission critical. Now, I want to speak to the concern about an interpreter shortage. I will let you know that that is a fallacy. There are many, many interpreters out there that are available. This bill serves to only identify and weed out those who are not qualified to be working, and also encourage them to obtain the necessary qualifications to provide interpreting services in the state. As a business owner and entrepreneur, it's important to me because qualified interpreters help me run my business. To give you a real-time example of this, the PG County Liquor Board was an organization that I had to stand in front of. I, of course, had to give testimony in order to maintain a liquor license in PG County. And I had to explain to the board that we had taken all the necessary steps to be in compliance. During my testimony, I felt ensured that my needs were being met with the interpreter who was there. They understood the message I was trying to convey, and they accurately represented me to the board. It was very, very nice to know that I could focus on my testimony and focus on it going well, because I could ensure that my interpreter was accurately conveying what I was signing. And as a result, our liquor license was approved. Now, I want you to imagine for a minute if I had had an unqualified interpreter in that situation who failed to accurately convey the information that I wanted to share with the licensing board. My license could have been denied, and I would have had to go through the entire process again at their next meeting, which would have been 3 months later. As a business owner, I would not have been able to brew beer for that time. I would not have been able to sell beer. Therefore, that would have impacted my livelihood and possibly put my business at risk. If my liquor license had been denied on the basis of an unqualified interpreter, that means my deaf employees would have been out of work. Oh, I'm just trying to be cognizant of the time. Okay. I thought we could, 3 minutes goes quickly. Goodness. Okay. So thank you so much for your time today.
Thank you, Mr. Burke. Ms. Puzio?
Good afternoon, Chair, Vice Chair, and members of the committee. My name is Dr. Leslie Puzio, and I am here on behalf of Frederick Community College and Dr. Rebecca Miner at Community College.
Ms. Puzio, I have you down favorable with amendments.
Correct.
Okay, in the computer you're in is unfavorable. So I just wanted to verify so that we knew the composition of the panel.
I'm sorry, the ED bill I'm unfavorable. This bill I'm in support with amendments.
Thank you.
Sure.
I'm so
Please
sorry.
continue and reset the
Sorry.
clock.
Yeah, reset. Sorry.
Not a problem. It's always good for a challenge, right? Thank you very much for allowing me to be here. Again, my name is Dr. Leslie Puzio. I'm here on behalf of Frederick Community College, as well as representing Dr. Rebecca Miner from the Community College of Baltimore County. Dr. Rebecca Miner and myself both last year shared a support with amendments for this bill. We have worked diligently with both Senator King as well as the Maryland Interpreter Licensure Bill to ensure that our amendments were met. Our amendments were met with high regard, and we're hopefully moving forward with this bill. As you may be aware, Frederick Community College, as well as the Community College of Baltimore County, are the only two programs in the state of Maryland that offer preparatory courses and degrees for sign language interpreters in the state of Maryland. It is imperative for this bill to pass, and along with that, our interns have access to skills and mentors. This bill allows for our interns to be able to continue their instruction and continue their learning through mentorship with a fully licensed interpreter. Though FCC and CCBC only offer an associate's degree, they will obtain at a minimum 60 credits of college credits. As stated in the bill, or as people may have already looked at, the Registry of Interpreters for the Deaf do require a bachelor's degree or an equivalent of 120 credits. A bachelor's degree is not the only required piece to get nationally certified. FCC and CCBC will support these students in getting at least halfway through those 120 credits needed to sit for national certification. This licensure bill will be established, this licensing procedure established a bill that interpreters can get either national certification or regional. It's very important for our graduates to be able to obtain those necessary skills, their volunteer hours, internship hours, and working hours to become nationally certified. As you are aware, Maryland currently has no regulations which determine who can market themselves as an interpreter. Sadly, and unfortunately, Maryland deaf citizens often find themselves in situations where the interpreter that was hired for their appointment, whether it be a business meeting, a doctor's appointment, or even a legal proceeding, working with an interpreter who is not qualified, some barely even able to sign. This is not fair to not only our colleagues in the interpreting profession, nor is it fair to our deaf community members. This bill is an attempt to set up a robust licensing procedure which will protect all deaf individuals, children, and adults in the state of Maryland We support this bill as written with the amendment of removal of Section 92435, as Senator King had already mentioned. It is important to also acknowledge that this bill, as written, includes necessary parameters for interns in both of the ASL-only programs in the state of Maryland. Thank you very much for your time, committee and chair.
Thank you, Ms. Puzio. We have two more favorable with amendments. I'd like to hear from them, and then we'll take questions. So if two of you, other than the bill sponsor, could step just to the first row, would be great. And let's call up Ms. Tina Joyner and Gabriella Davis. And then committee, and we'll take questions for the panel. You may proceed in whatever order you choose.
Hello, Chair, Madam Vice Chair and Committee. I'd like to introduce myself. My name is Tina Joyner. I am the Vice President of the Maryland Association of the Deaf, and I'm here representing the deaf constituents in the state of Maryland. We would like to thank Senator Nancy King and Heather Bagnell, our delegate, for their support through this process and the work we've done with them in bringing these bills to fruition. Sorry, I did not bring the right set of glasses. So there's been mention that there would be a shortage of interpreters with this bill. That is not true. Once licensure happens, it will actually broaden the pool of interpreters and encourage more interpreters to join the field in the future, as well as specialize. I want to talk a little bit specifically about our hospital system and one situation that happened. Okay, we had a couple that went through quite a long and expensive process because of an unqualified interpreter that was brought into their medical situation. And this happens in a variety of different settings, including legal, medical, educational, so forth and so on. In addition to that, agencies are also sometimes guilty of sending unqualified interpreters to places like court and creating ID badges that look similar to the badges that qualified interpreters use to allow those interpreters to skate by, for lack of a better word. We need to make sure that all of our interpreters are qualified and interpret verbatim what we are saying. And we feel confident that with the passing of this bill, it would expand the pool of those types of interpreters. The community wants all businesses, agencies, and organizations to be accountable for interpreter licensure. So not just those individual interpreters who are working, but the agencies that often direct interpreters towards assignments as well. Licensure would require that accountability. And the licensing board would then also be responsible for enforcing it. We want to stop the historical misrepresentation of the deaf community and the undue harm that has been caused by fraudulent and unqualified interpreters. So I ask the committee to vote in favor of this bill with amendments. Thank you.
Thank you, Ms. Joyner. And finally, Ms. Davis.
Hello, good afternoon. Chair Pinsky and Madam Vice Chair Kagan, as well as the committee. I'd like to introduce myself. I am Gabriella Davis, and I am representing the Prince George's County Association of the Deaf, of which I am president. So I'm here in favor of the bill on behalf of PG County deaf and hard of hearing community members, as well as community members throughout the state, to be honest. We have a very, very diverse community. And we feel it's important that people recognize our needs and vote in favor of this bill. I'd like to share with you, we are in support of MDIL's bill with amendment because we want to ensure the quality of interpreters in the state of Maryland and make sure that there are no fraudulent interpreters out there working. And I want to share a little bit of an anecdote of a situation that took place approximately 3 months ago. A deaf woman was hospitalized for a surgery. She requested an interpreter. The interpreter arrived. And the interpreter themselves is what's considered a coda, meaning they had deaf parents. Somehow, over the course of the interpretation, she called the doctor and the nurse to come in, and she informed them, and basically explained, thank goodness that her older daughter was present. Her older daughter, of course, also happened to be a coda, okay? So we had the interpreter working in the room, and then we had the woman's daughter. The woman's daughter did that cultural brokering and basically fixed the interpreter's interpretation, which was incorrect. And they had to call the doctor and nurse in to clarify information. This is not a new experience. This has been going on for time immemorial, deaf people having to utilize family members to make sure that being represented accurately. This is due to a lot of different things, a lack of qualifications, a lack of training, ultimately a lack of licensure and oversight. And we'd like to see this practice stop because ultimately it leads to harm and suffering for the deaf community. We want to be able to trust the people that are working with us. And we would like the state of Maryland to force interpreters to do their best work and do their utmost job in representing us and representing the deaf community, as well as the deaf-blind community and the hard-of-hearing community throughout the state of Maryland. So I strongly encourage the committee to vote in favor of this bill, and our organization supports that. Thank you.
Thank you very much. We're going to move to questions. I have the vice chair, followed by the chair.
Thank you so much, Mr. Chair, and I just want to apologize if I have to leave quickly because I'm going to be summoned to another committee pretty quickly. So I'll start by saying thank you to Senator King.
Very good.
Okay, for this bill, and thank you to everybody who testified. And I'm going to leave my mask on because you have interpreters. I have two things. First off, for colleagues or anyone watching at home who doesn't know, CODA is the child of a deaf adult, someone who was raised or may have a parent or guardian or something. So that's, that acronym was used, and not everybody may know that. But I have a question, and I'll toss it first to Senator King, unless you want to toss it to someone else. On page 8, of the bill, and it talks about the board of 7 members being appointed. On page 8, lines 2 and 3, 4, which is a majority of the board, shall be determined by the board by regulation. And that seemed pretty loose and pretty not accountable. And I just wondered if you had thoughts about that and whether that was one of the areas of possible amendments. So I toss that to Senator King or any of our
I'm
representatives.
going to bounce it over to the advocates.
Thank you. Is there one advocate, because we really usually only have one person who answers, so is there one person who has already spoken, Ms. Summers? Stephanie Summers. And if you don't know the answer, it's okay to get back to us, but to the degree that you have an opinion, we'd love to hear it.
So sure, I can speak to the rationale. The reason why we went with 3 individuals, well, or 7 individuals, 3 will be representing the community. Maris Association of the Deaf will have representation, PCRID, the Potomac chapter of the Registry of Interpreters of the Deaf will have representation, and then a deaf-blind community member. The rest will be drawn from the community. As I mentioned, our community is extremely diverse, and we want to make sure that we have as a diverse representation on the board as possible to impact this bill. So we will be drawing in people with their expertise to speak to this bill, be it an interpreter, be it somebody working in the interpreting profession in another capacity, but again, yet to be determined.
Okay. I may follow up with you, Senator King, to learn more. Thank you, Ms. Summers. Thank you, Mr. Chair.
Thank you. I've got a couple of questions. First, let me welcome Mr. Burke from Streetcar. They have created a great business. It happens to be in my district. They're doing a terrific service to the deaf community and the hearing community who are utilizing his place, and I encourage everyone to come and visit Route 1 in Hyattsville to Streetcar. Questions on the substance. It's my understanding one of the requirements is having a BA degree. And the first question is that a BA degree in interpreting or any BA degree?
That would be any BA degree.
So following up on that, a BA degree in sociology or in chemistry, what is the relevance of that to being a qualified interpreter?
Chair, if I may. As representing Frederick Community College and as a nationally certified interpreter, the bachelor's degree was a requirement that RID, the Registry of Interpreters for the Deaf, established over a course of several years. The difference between having a bachelor's degree in anything, an interpreter to sit, they can have a bachelor's degree in any field. The big thing is why the relevance there is it's providing the educational experience and the educational knowledge. When an individual has that bachelor's degree, they do actually have to go through a two-tier process to become nationally certified. There's a knowledge assessment, and then there's a performance assessment. So though someone may have a degree in, say, astrophysics or chemistry or even English, they still have to have the proficiency in both American Sign Language as well as the proficiency in interpreting.
But I'm going to, I guess, throw back your earlier testimony. If someone has an AA degree from Frederick Community College, where there was systematic work and curriculum on interpreting and signing or whatever, and then they could pass a performance assessment, I'll ask you again, why do they need a BA degree?
Great question. And so as we stated, or as I stated, and I think some of my other colleagues stated, it's not just a bachelor's degree requirement. It's actually a bachelor's degree or alternative pathways, which is an equivalent of 120 credits, which is equivalent to a bachelor's degree. So say someone comes to Frederick Community College or CCBC and goes through the AAS degree, they'll actually obtain 60 credits through our programs, and then they can actually obtain those additional credits through other college courses or through work.
Now, I understand how it works, ma'am. The question is, what is the value added? In other words, if you have a specific program for interpreters, 60 credits, and someone can pass the performance assessment, why are we requiring people to go to college for 2 more years to do this?
That's a great question. That was established by the Registry of Interpreters for the Deaf. Again, they before did not have any.
We have legislation in front of us. We set policy for the state. And I guess my question, I don't want to, not everyone can afford college or needs college or chooses college. But they might either graduate with an AA degree or be a CODA, a deaf adult, who can pass the performance and do a darn good job. And I'm just trying to understand how requiring a BA degree is rooting out the bad actors.
Okay, so I think I understand what you're asking. I think that as the bill states, it's not just a bachelor's degree. We actually have 3 different tiers in the bill. One states national certification, the second states regional certification, and the third says criteria established by the board to encompass those heritage users, as we oftentimes call them as CODAs. So it's not just a bachelor's degree requirement. It could be other assessments deemed by the board at a further date.
I understand there are a couple of other, I'm still trying to understand why the bill is drafted is requiring the BA. And again, look, I have a degree and I encourage people to go to college, but as we heard on the floor regularly from one of our colleagues, there's a lot of career paths that don't necessarily require skill development, no question about it. But I'm just trying to understand this. That's the part. And if someone is a CODA who can pass a performance assessment, will they get a full license or will they get a provisional?
If I could answer that question,
Please.
Chair. It would depend. It would depend on the type of testing that they take. For example, someone who is, for example, one second, we're just making sure everybody has visual access. For somebody who is not yet certified, if they have taken the initial part of certification, the cursory part, which is a written component, they would then get a provisional license. They would then have a 3-year period to take the second part of the test, the skills part that you've mentioned. If they pass that within a 3-year period, they would be given full licensure at that point. If they do not pass it within that period, the bill allows them to get 2 additional extensions of 1 year each in order to pass the performance section. Again, depending on the type of test that they sit for and what the requirements of that test are, in order to reach full licensure. We are trying to provide interpreters multiple pathways and multiple mechanisms, not just the BA requirement. There are other pathways that they can reach licensure through that don't require a BA. We're trying not to make this restrictive. We want to keep the pool of interpreters as large as possible and ensure quality, and so we are providing multiple mechanisms to reach that through.
So let me make sure I understand your answer. If someone takes the written test and within 3 years takes the performance assessment and passes both, they can become licensed, regardless of their degree status.
That is correct. They, of course, also have to earn a specific number of hours, training hours, that is part of that. Interpreting on the job. Once they earn that and develop that skill set, that is one of the areas that will be developed by the licensing board in terms of criteria, what those continuing education, for lack of a better word, requirements will be. So they need to pass the exam plus a specific number of hours of on-the-job experience, yet to be determined. And once they meet those requirements, they will be granted full licensure, yes.
Fine, and I'm going to, and I don't know if this is a comment or a question, or I end it with, isn't that so? I've seen other fields, dentistry, teaching, whatever. There are people who are licensed and end up being underreported, under-effective, and reported. So licensure isn't a full guarantee. And I think in the example I believe you mentioned, it was another child of a deaf adult who corrected it. I don't know if they had a BA degree or not, but I think in lots of these categories, you have people who are really good at what they do and some who aren't so great, regardless of their pathway. Isn't that so? Senator Ellis, Senator Washington, did I see the light on? I'm going to go with Senator Ellis first, but do you want to be in the queue? Okay. Senator Ellis.
Thank you, Mr. Chairman. Thank you, Senator King, for this bill, and I hope I can be part of the solution. I'm just trying to fill in some of the gaps in my understanding. So I understand what you're saying about the need for a bachelor's degree. I understand the test part. So my question is on educational or training programs. Do they have any of those in Maryland, like at a community college or a university, where someone can major or minor in signing? And if that's the case, are any of those programs accredited?
Yes, so I would like to answer to that if I can. So
And lean into the mic if you would.
Oh, I'm so sorry.
It's being recorded and streamed, that's all.
if I can again,
Keep the mask on, just,
mask on.
we want the mic to be able to pick it up, that's all.
I'll get a little close to you. If I can answer that, so both Frederick Community College as well as the Community College of Baltimore County, both are the 2 accredited programs in the state that are accredited with AAS degrees in American Sign Language Interpretation. So we both are accredited through MHEC, the Maryland Higher Education Commission. FCC has been established in 2017, and CCBC has been running for over 20 years.
I'm sorry, using acronyms. I'm
Sorry, Frederick Community College.
Okay.
And
Been
the Community
accredited
College of
for.
Baltimore County. Both have accredited Associates of Applied Science degrees in American Sign Language Interpretation.
So, okay, thank you for that. So, how about at the bachelorate level? Are there any accredited programs? Someone get a BS and
Great question.
American
So
Sign Language.
in the state of Maryland, there are not, but both CCBC, Community College of Baltimore County, as well as Frederick Community College, have articulation agreements with Gallaudet University, which has a 4-year degree, bachelor's degree, as well as a master's degree in ASL interpreting, and Gallaudet University is in Washington, D.C.
Yeah, so those students who go through your accredited sign at the community colleges, Do you feel they're fully qualified to perform in all situations?
No, I do not. I think that just like with any language acquisition or skills further than that, 2 years is a preliminary learning curve. And so additional, just like we stated with the alternative pathways, there are other options for students to gain experience through pro bono work, through mentoring programs, and so those additional experiences that they can obtain will apply directly to that alternative pathways within the Registry of Interpreters for the Deaf. It's not the bill that's requiring their bachelor's degree, it's the national certification
Okay.
that's required. So students can go through our program, go through a mentoring program to gain that extra experience.
Okay, I was surprised by that answer. But you're saying that, so, I mean, I know in certain fields, students go through community college, like nursing, get an associate's in nursing, and they become RNs. And so what would make it so much more difficult where the community college could not properly educate these folks to get associates to be fully qualified to, with experience, of course, maybe put an internship in there or a practicum or something? Why is that not happening?
So my answer, no, was actually to be qualified in any area. So interpreters in general, I've actually been nationally certified and been working for over 17 years professionally. There are certain areas of interpreting that I do not walk into because I do not have those skill sets. I do not walk into a courtroom and interpret, but I will definitely walk into a hospital emergency situation. So the answer, or the question of, are my students graduating and able to go into any situation? No, they're not. But my students are definitely qualified, as well as CCB students, to go into various situations depending upon the skill sets they've learned there. Interpreters working professionally or just recent grads have to gain other skill sets. Just like someone may graduate with an English degree, does not mean they can go teach English. So same thing with interpreting. They have to gain other experiences through different professional development.
Yeah, and that you're talking about specialization.
Yes, sir.
So if someone wanted to do courtroom legal versus medical, there's specialists in the profession who can actually get that experience.
Yes,
So,
sir.
so going from, can I follow up, Mr. Chairman? Okay, thank you. So going from the community college level, you said there are no baccalaureate program in Maryland. So Gallaudet and other schools have. So students would actually go from the community college to one of these other schools to get that advanced, lack of a better term, preparation to be a specialist in interpreting.
Well, they could certainly go on to receive a bachelor's in interpreting. A lot of our students from FCC as well as CCBC do start working. Again, it's based off of their qualifications, but an individual who wants to continue their education can certainly go on to Gallaudet University, but it's not in a specialized field. Those are usually obtained through professional development and workshops within those certain criteria.
Okay, great, thank you.
Absolutely.
Appreciate it.
Senator Washington.
Thank you. I just want to find out if this is, and thank you for this bill, and like Senator Ellis, I definitely want to figure out how to get to being part of the solution here. I just want to see if this is boilerplate language. On page 20 there's a bunch of processes for denying the license and fraudulent and legal. Is this all boilerplate for every license? So it's on page 20, I guess lines, let's say 4 through, it goes on for a while. Page 20, 21. Is that just
Yeah, I'm not
boilerplate?
sure if the advocate's going to be able to answer that or not. If you can, that's fine. Our committee counsel said part of it is, but we'd have to get back to see whether it's all boilerplate or some of it's taken from other agencies or not.
Yeah, because I was just wondering, there was specifically, number 2 is deemed legally incompetent to provide sign language, that they use alcohol, that they're dishonest, unethical, immoral, that they were convicted of a felony or a misdemeanor, I'm just wondering if any of those, so if we could find out if any of those are specific just to this, or why are those necessary?
We'll get back.
She'll get back.
Unless you can answer it, we'll have committee counsel, I think.
We can answer that, Chair.
Okay.
Okay. So the question that you're asking, to answer your question, Senator Washington, is not boilerplate. That was something that was developed, hold on, we're just making sure everybody has access, sorry, based on collaborative workings with a variety of stakeholders.
Got it.
We came to the determination that these were the things that we wanted to do a restorative justice path or approach to be able to settle through mitigation any type of disagreement between two parties should a situation arise that would warrant it. So it is not
Oh,
boilerplate
so these are the
language.
situations, I guess I don't, these, so it says, the board may deny a license to any applicant or revoke a license or impose a penalty on a license if the following things happen? So that's what so if they.
Yes, yeah, and then these are things that would be happening during the interpreting job, not in the person's personal life, not outside of the interpreting scenario. If something happens in their personal life, that's different, but if this were to happen, for example, drinking on the job, that would be a situation. If the deaf consumer, the hearing consumer, a witness could file a complaint about an interpreter engaging in one of those acts, and then we would move forward from there.
Okay, okay, good. Well, I just would like to talk about those things. And there are some things in which it says during an assignment and others that it doesn't, like 3 and, yeah, so there's a number, particularly around the misdemeanor and felony. We've done a lot in Maryland to, Second Chance Act and that. So, making someone ineligible, for that sort of thing is not, but, yeah. So we'll go through all of these, and it would be great to see that. I guess my other question is around the debate or the discussion around college. Are you open to someone having a high school degree, a terminal high school degree, but then getting the 120, the additional training, and then being able to be fully certified over time, understanding it takes time?
Great question. So this bill actually is not dictating what degree an interpreter must have. We're just stating that the national certification right now requires a bachelor's degree or equivalent. It's not the bill that's stating that. So an individual who may be a child of deaf adult, who is a high school graduate, and maybe they took college classes during high school, or maybe they've been working, say they're 19 and a high school graduate, they've been working professionally, that's where they can also apply for those alternative pathways through the national organization to go for the performance.
Okay, all right, thank you. Thank you.
Absolutely.
Seeing no further questions, that completes the hearing on this bill. We may be asking for further input later on as we work up the bill. Thank you all for your testimony and patience. We're going to move into the second bill, which is on the same general topic, but approaches part of it from a different view. This is Senate Bill 370. Educational interpreter certification requirements. Again, Senator King from Montgomery County. She'll start off. She'll be joined by Michelle Morales, Cynthia Gonzalez, and Heather Beck. So if a couple of you want to come up to the table so we can try to do this seamlessly, we will. They will be followed by Lee Egbert, and then we'll take questions. Then we will go to the opponents, which includes 2 of the people who are on the last panel of proponents. That being said, Senator King, welcome back.
Thank you, Mr. Chairman. Thank you for your indulgence this afternoon. I just want to mention, I have a subcommittee that I'm supposed to be running upstairs, so I'm going to give my testimony, and with your permission, I'm going to sneak out of here and go back up and run my meeting. Mr. Chairman and members of the committee, Senate Bill 370 will require the Maryland State Board of Education to adopt regulations on or before July 1, 2023, for the certification of educational interpreters in public schools. The bill further requires that any educational interpreter employed by a public school must obtain certification by July 1, 2029. Colleagues, you may be wondering, why two bills for sign language interpreters? The bottom line is, providing interpreting for children is very different from interpreting services for adults. We pride ourselves in Maryland for the work we have put into assuring our K-12 public schools provide a world-class education for our children. We have requirements for our teachers, guidance counselors, and administrators because we want to make sure our children are working with professionals. We owe that same commitment to excellence to all of our students, including those who are deaf or hard of hearing. Senate Bill 370 will help ensure that the interpreters working with deaf and hard of hearing students have the proper training and qualifications for the job, and so I respectfully request a favorable report.
Thank you, Senator. Is that right?
Thank you.
Before we get to the next speaker, I just want to acknowledge a couple of our colleagues. Senator Andy Serafini from Western Maryland is here. Andy, welcome. Great to see you. Hope you're doing well. And is that Mac Middleton back there too? Mac Middleton, two of our colleagues. Great to see you want to spend your afternoon in Education, Health, Environmental Affairs on this nice, lovely, warm day outside. So we appreciate whatever the draw is bringing you here. Hopefully it's
My bills.
a bill. But thank you both for joining us. I want to acknowledge them. Okay, let's go to Ms. Morales, please.
Okay, I'm first. All right, thank you so much for your time, committee, and for allowing me to be here today. I'd like to introduce myself. I am Dr. Michelle Morales. I am an educator and one of the co-authors for the Educational Interpreter Certification Bill. Now, according to the NAIE, which is the National Association of Interpreters in Education, it states that Maryland does not currently hold any requirements, and I believe is one of only 6 states without any qualifications for educational K-12 interpreters. Deaf and hard of hearing students in the public school system have a right to FAPE, free and appropriate public education, and to effective communication in those settings. Public schools are obligated to provide effective communication based on the mandates of 3 laws: the Individuals with Disabilities Education Act, the Americans with Disabilities Act, and Section 504 of the Rehab Act of '73. Maryland prides itself as being one of the most educated states in the country. When it comes to the lack of educational interpreters that are qualified, that meet the minimum level of qualifications for students, Maryland really should be ashamed. 90 to 95% of all deaf and hard of hearing children are born into hearing families with hearing parents, the majority of whom at their child's birth do not have the skills to communicate with them yet. In early years, children are in the process of what is called language acquisition, which is the development of language. By the time they reach school age, their language abilities might not necessarily be age appropriate based on all those factors. Therefore, having educational interpreters that meet those minimum requirements are necessary to foster successful language development. They are also necessary to provide language access for direct instruction, incidental learning opportunities, and social emotional learning and development. Without communication, our deaf and hard of hearing students have nothing. When they receive subpar interpreting services, they do not have access to an equitable education, and the problem for those students compounds on an annual basis. Deaf and hard of hearing K-12 students are not the ones that are obligated to advocate for themselves regarding the quality of the interpreter that sits in front of them. The results of this, including illiteracy, are disabling and can become a public health issue and a burden to society ultimately. We don't need to contribute to this, but inadvertently, through inaction, we often do. Now, this bill is not our first attempt. Interpreters have had over 20 years working in the education K-12 field to improve their qualifications. In 1990, the Maryland State Department of Education, sorry, I'm just checking my time, the Maryland State Department of Education, MSDE, published a 26-page guideline document entitled Assuring Quality, let me make sure I get the title correct, bear with me, Ensuring Quality Interpreting Within the Educational Setting for Students Who Are Deaf and Hard of Hearing. 26 pages written by 16 stakeholders on an advisory panel. Unfortunately, it's not available on MSDE's website currently, but if you're interested, there is a PDF I can send to you. Currently, out of approximately 150 known part-time and full-time educational interpreters in the state of Maryland, approximately 10% hold certification. That means that 90% of the educational interpreters who are sitting in front of students are unregulated when it comes to quality and yet draw money from public funds in terms of their salary. I have been saying for years that we need to make sure that the deaf and hard of hearing students in public school have communication access. And since that 26-page guideline of documents is not enforceable, we need to take a different approach, and that's why we're here today. Our second attempt happened during the 2020 legislative session, and it was sponsored by Delegate Schuh and 15 co-sponsors at that time. Attempt number 3 came in the 2021 legislative session, sponsored by Delegate Schuh again, as well as Senator West. Now, in this, our fourth attempt, I would like and ask the committee to think about our deaf and hard of hearing K-12 students and support their right to equal access and an equitable education by supporting this bill and voting yes. So thank you.
Thank you, Dr. Morales. Cynthia Gonzalez, followed by Heather Beck.
Oh, okay. Hi, everyone. I'm Heather Beck. I'm an educational interpreter of 23 years now. I also have a deaf son. He's 8 years old. There are 2 different interpreter bills that are being presented to you today. I want to let you know that I think both of them are extremely important. This one specifically, though, SB 370, is requiring educational interpreters hold state credentials through the Maryland State Department of Education, the same as every other related service provider that works in any county in Maryland. They all have state credentials to work with deaf children. Community interpreters have a very different set of responsibilities, so I just want to be clear that we are working towards a separate issue here. Educational interpreters are defined by IDEA as related service providers, qualified, integral participants on a child's individual education plan, staffed by school systems, responsible for equal access to education and language development and acquisition. The Maryland Department of Education has requirements for all related service providers, except educational interpreters. Related service providers can include teachers of the deaf, audiologists, physical and occupational therapists, nurses, psychologists, speech therapists, and educational interpreters, who spend 1 to 3 years with a student for 6 hours every school day. That is more time than any other related service provider, and Maryland does not hold educational interpreters accountable. To work as an educational interpreter, 44 states require proof of competency. Maryland is one of 6 states that does not. Exams are already in place here in Maryland. The Educational Interpreter Performance Assessment, EIPA, has 2 testing sites. The nationally recognized Registry of Interpreters for the Deaf, RID, that you heard about previously, has 5 sites, and the exams given by Center of Assessment for Sign Language Interpreters can be taken at any Scantron location. There is no additional work needed to ensure that educational interpreters have credentials. Interpreter programs exist at McDaniel College, Catonsville Community College of Baltimore, and Towson University. Various counties provide mentorship opportunities for student interpreters in education. In fact, interpreting students must work with certified personnel to graduate, yet deaf kids in public schools may graduate without ever meeting a certified interpreter. When coordinators of countywide services hire professionals to work in their respective departments, they rely on standards mandated by the state to know if a person is qualified to work in that field. Educational interpreting is rarely something they are familiar with, and there are currently no state guidelines to help them. Because of that, deaf children are paired with signers who have minimal sign skill, zero training, and no idea how to support learning and language acquisition. They have no certifying body to answer to and no accountability. Maryland has the opportunity to catch up with the other 44 states. I hope we can find a favorable.
Thank you very much.
You're welcome.
Heather Beck?
That's right.
Sorry, Senator Pinsky. Good afternoon. I misunderstood the directions. My name is Cynthia Gonzalez. Hello, Senator Pinsky, Senator Kagan, and all the members of the Education, Health, and Environmental Affairs Committee. My name is Cynthia Gonzalez, and my comments today relate to Senate Bill 370, sponsored by Senator King. Currently in Maryland, there are no credentialing requirements for sign language interpreters in any profession. I believe the Maryland State Department of Education should be involved in the certification of sign language interpreters who provide services to deaf and hard of hearing students in kindergarten through grade 12. Students who use sign language interpreters or educational interpreters have no guarantee that the services they receive meet any kind of standard. It is appalling that in 2022 we have no formal way to ascertain that the language providers for at-risk students can meet their academic needs. We as Marylanders passionate about education have an incredible tool in the Blueprint for Maryland's Future. The Blueprint offers the chance to elevate all students to college and career readiness by closing achievement gaps. Senate Bill 370 can help with that. State Superintendent of Schools Mohammed Chowdhury was interviewed for an article which appeared in the Maryland State Education Association's magazine, Action Line, in December 2021. In it, Mr. Chowdhury stated, quote, MSDE must be focused on delivering the needed resources to support school systems in narrowing and closing opportunity and achievement gaps. That can be found on page 15. An example of needed resources are well-qualified educational interpreters. Without clear guidelines from MSDE, districts may hire people unqualified to provide the best access for students. Mr. Chowdhury also said student success is dependent on an ecosystem of support on page 17. That ecosystem is composed of many people, both in and out of the regular education classroom. Students meet adults who impact their success along with teachers and related service providers or RSPs, those that Ms. Beck mentioned in her comments. As part of that team, educational interpreters provide unique and vital support to deaf and hard of hearing students. Mr. Chowdhury is well aware that gaps exist in our education system. So are we. Pass Senate Bill 370 to close this one. Thank you.
Thank you, Ms. Gonzalez. Ms. Egbert, can we vacate, open the seat for Ms. Egbert, then we'll take questions from the committee.
Hello, I'd like to introduce myself. I'm Dr. Lee Egbert. I'm a parent of a deaf and hard of hearing child. I also happen to be a member of the deaf community myself, and I'm an educator. I'm one of the co-authors of the bill. And today I would like to talk a little bit about parents. Parents, are we okay? I'm getting a signal? Okay, just checking, sorry. Parents are a critical part of a child's education experience, of course. And this bill will allow parents to feel confident and know their rights and responsibilities in terms of asking and demanding a qualified interpreter for their child if they're in a K-12 setting. When I went to my school and my children's school, honestly, I saw my children interpreting and reinterpreting for some of their deaf and hard of hearing classmates because of the lack of the qualification of the interpreter on the scene. you would see just fragmented words like school without a complete sentence. Okay? We need qualified, competent language models for our deaf and hard of hearing students, not random fragmented words. Without that, we can't expect our deaf and hard of hearing students to achieve in a K-12 setting. This bill will allow parents to do the right thing, and it will empower them to advocate appropriately for their child, either by requiring their interpreter have the EIPA or RID certification. Right now, parents are at the mercy of the school system where their children go to school, and we need to give back that educational power and those educational rights to the parents who know what is best for their children if they are in a mainstream setting. When my family moved here from the West Coast, we were appalled that Maryland was one of the states without any type of enforcement for interpreters. 90% of other states provide some type of enforcement or qualification requirement. You have heard today, we've talked about schools, we've talked about words like licensure and words like certification. Let's talk about the students who are sitting in the classrooms right now. Let's talk about their learning. Let's talk about their educational experience, okay? Let's talk about whether or not this is going to prevent more, how do I say, barring more students from being successful for their education, or whether we want to do something that is easier for the schools. Okay, really, the bottom line, when all is said and done, is the students who are in front of those interpreters. And that's why we need your support in ensuring deaf and hard of hearing students' literacy, and part of my way of doing that is by supporting this bill. Thank you.
Questions, committee? Questions? I have one. And I guess my question is, and this surfaces from the earlier bill hearing, if there were a bill next year to have certification for interpreters who work in the judicial system, or certification for interpreters who worked in the medical field, would you folks support that?
Could you repeat the question? I'm sorry, Chair.
The previous bill had sort of an overarching licensure program. And I think the question becomes, should there be certification or licensure or approval for subspecialties, I guess is my question. And while the earlier bill was, for want of a better term, an umbrella, should we start dealing with subspecialties or subspecialties? And we've seen this in other areas, and other people say, well, we'll stop after we are approved. So I'm trying to understand if this would be the first of many subspecialties.
Understood, Chair. I think I understand your question, and I can speak to that. So the Educational Interpreter Certification Bill is focusing on K-12 children, okay? This is not exactly a specialization. Other specializations that you mentioned, medical, legal, so forth and so on, that's dealing with adults, I'm assuming, adults in the court system, let us hope, not children. Anyway, so that being said, that is focusing on adults, okay? And those are specializations when working with adults. That is a very different animal and a very different skill set than interpreters who work in a school system. They are not just interpreting, they are also providing support for language acquisition, being language models, so forth and so on. It's a completely different skill set. It's a completely different knowledge base. You have the National Association of Interpreters in Education, one organization that was set up specifically for that reason, which is very different from the Registry of Interpreters for the Deaf. So I hope I'm answering your question, but the field acknowledges that these are very distinct, separate skill sets and different types of interpreting.
Thank you. Further questions from the committee? If not, we'll move to opponents. Thank you for your testimony. We will move to the opposition. Ms. Tina Joyner and Leslie Puzio from Frederick Community College. Please proceed in whatever order.
All right, hello, Chair and Madam Vice Chair. My name again is Tina Joyner, Vice President for Maryland Association for the Deaf, resident of Frederick, Maryland. Our organization strongly believes in community collaboration for any decision. Our organization is in favor, and supports deaf from birth through end of life. And Maryland has 1.2 deaf and hard of hearing constituents that live within it. Okay, so that's a pretty fair number. This includes not only culturally deaf, but hard of hearing, deaf blind, so forth and so on. And there are interpreters that are needed by all of these constituency groups to remove communication barriers and allow deaf people to thrive. Our children are our future, no question. And we want to ensure, of course, that students have qualified interpreters in the K-12 setting to make sure that they are accurately conveying all their information as they journey through their educational career. That being said, unfortunately, the Maryland Association of the Deaf cannot support this bill because the community was not asked to participate in the drafting of the bill. We do have some concerns about some of the language as the bill is currently written. And we do have concerns that the bill will allow individuals in Maryland State Department of Education who are unfamiliar with the nuances and the needs of educational interpreting to make decisions creating further disparities. Now, again, if we have somebody like a teacher who is very qualified, an interpreter who is not, okay, that is not equal access to education for the deaf and hard of hearing children in that classroom, and we are very concerned about that. Myself, having gone through a mainstream experience growing up for my educational journey, I know what it feels like, and I know the difference between right and wrong, and I know what a qualified interpreter is and isn't, and I don't want to put any other student through that. Not only that, the previous bill also talked about medical and legal interpreting. That also includes children, okay? Regardless, we are in support of the entire gamut of the deaf community from birth to the grave having access. So, I respectfully ask that this bill be withdrawn until they can work with other members of the community and other stakeholders for input so we can make a bill that is equitable for all. Thank you.
And thank you, Ms. Puzio.
Good afternoon again. I'm Dr. Leslie Puzio, representing Frederick Community College. As we know, deaf children in the K-12 environment need well-trained and qualified interpreters to provide them with accessibility per their rights outlined in the Americans with Disabilities Act. Our program provides students with an AAS in American Sign Language with the foundational skills necessary for a student to start their interpreting profession. However, it is important to note that the program prepares interpreting students the skills to work in environments not specifically related to the K-12 setting. However, Frederick Community College, after seeing the bill submission last year and with the hopes that this bill would again be submitted this year, applied for a Perkins grant through the state of Maryland that would prepare K-12 educational interpreters ready to work under the previously proposed interpreter expectations. FCC was awarded that Perkins grant for fiscal year 22-23 to establish an ASL educational certificate that will prepare students to take the EIPA, the Educational Interpreter Proficiency Assessment, at the end of a fourth semester certificate program. The program will be start being offered in summer of 2023. And at the end of the program, students will take the EIPA with an aim of a 4.0 or higher. A 4.0 may feel like a high expectation, but it is important to be aware of that the 4.0 that we as interpreters walking in through K-12 settings are language models. And deaf children not only learning lessons in class, but these interpreters are also potentially teaching sign language. The licensing procedure has left all organization and requirement criteria to the Maryland State Department of Ed, and chose not to include items such as delegation of board members, advocacy support groups, such as the Maryland Association for the Deaf, Potomac Chapter Registry of Interpreters for the Deaf, National Alliance of Black Interpreters, and even parents of students receiving services, either community collaboration or K-12 interpreter collaboration oversight, and criteria for the K-12 ASL interpreters. This bill is an attempt to set up a bare-bones licensing procedure which will protect all deaf children in the public school system in the state of Maryland. However, without further concrete collaboration with necessary bodies and organizations in the state of Maryland, we at FCC do not support this bill. We are opposing the bill as it is currently written. We hope to see this again next year in the legislative session with the following amendments. A board makeup to include a representative from MDAD, Maryland Association for the Deaf, PCRAD, Potomac Chapter Registry of Interpreters for the Deaf, an educational interpreter at the expected level or above, a parent of a deaf child, and others deemed by the board after the board establishment. We are also requesting that an amendment be made for an EIPA 4.0 score or higher. And lastly, prior to submission moving forward, community, both deaf and hearing, members, engagement and feedback to the bill language. Lacking community buy-in is paramount.
You can finish your sentence.
Thank you. It's a paramount to a bill that can affect so many lives with very specific outcomes and expectations.
Thank you. I appreciate you following the rules. We're not that pure. Question for the two opponents. Senator?
Yeah, thank you, Chairman Pinsky. And so, listening to your testimony, first lady who testified, if you could tell me your name again,
Tina Joyner.
Okay, Ms. Joyner. Yeah, you, I think, mentioned several, I say, categories of deaf. I think you said socially deaf and two more categories. Could you expand on that for me?
Okay, so the Maryland Association of the Deaf is the organization I represent. And deaf is an umbrella term that includes the deaf community, hard of hearing, and individuals who identify as deaf-blind. So that's what I was referring to.
So, okay, there's a term you said socially, I think socially deaf. You didn't, did I mishear that?
Oh, okay, so all right. When we talk about the deaf community, like I said, is an umbrella term with 1.2 million people. Within that community, there are people who consider themselves culturally deaf. They use a specific language, so forth and so on. So it's important that our interpreters interact with the community because that's what helps them, develop, and then that subsequently helps, with things like school and education and so forth and so on. So it's just one part of the category of that which is deaf.
Okay, yeah, so I did hear you correctly. Culturally deaf. So could you tell me again what someone who's you would define as culturally deaf, what is that person specifically as far as in the community?
So American Sign Language is part of our culture, okay? That's not something that the hearing community has. That's not every person that has a different hearing status uses, okay? So this is, somebody who grows up without any access to auditory input, has a life just like all of you. We operate in a different culture. We have different norms, we have different behaviors, we attend social events together, however, just like anybody else, it impacts every facet of our life. So, and I don't want to go into a whole Deaf 101 lesson, but, it's a category of individuals.
Okay, well, thank you.
Thank you. Senator Washington with the final question.
Yeah, I apologize for having to do Deaf 101, but we, if we're making a good decision and an informed decision, you want us to know as much as possible. And so I think we think of not being able to hear or deaf as a biological thing or just a physical function. And so you're introducing the concept of that there's a cultural component to it. So that's what I was I'm trying to understand. So to someone who maybe their parents are able to hear, but the child, for whatever reason, was born not able to hear. Are they culturally different from children whose parents are non-hearing and they are non-hearing? Is that a different culture?
Yes, it can be. It can be considered a different culture. For example, if we're looking at two families, we have a family with deaf parents and deaf children, okay? They learn sign language from the time they're born. They have access from birth. Hearing parents who have a deaf child, for example, in my situation, my parents did not know sign language, and that became very much frustrating for me. So I encourage my parents to sign. We encourage parents to sign and to expose their children either through school where they can learn sign and then bring it home to their parents. So their experience, their quote unquote cultural experience is a little bit different. So getting the parents involved then is very, very important because it impacts them. And a moment for interpreter clarification on my part. When you before mentioned 1.2 million deaf, hard of hearing, mean all 1.2 sign, no, some deaf culture. That's why that word. Clarification. Yeah, so just, and the reason that was done is because that 1.2 number of deaf and hard of hearing in the state of Maryland does not mean all ASL users. It encompasses all of those under that umbrella.
Okay, all righty. Thank you. Thank you.
Okay, thank you. That concludes the hearing on this bill. Thank you all for your patience and your testimony. The next one is an administration bill. We have Ms. Chase from the governor's office. Mr. Serafini, please come forward and welcome to EHE. This is state government, quasi-governmental units, oversight and governance. I don't see anybody signed up orally or with written testimony in opposition. So welcome, Ms. Chase and Senator Serafini. It's great to see you, Andy.
Thank you, Mr. Chair. It's great to be back in person in front of EHE. Good afternoon, Mr. Chair, Vice Chair, members of the Senate Education, Health, and Environmental Affairs Committee. My name's Erin Chase, and I'm here on behalf of the Governor's Office, here today to ask for your support for Senate Bill 399, State Government Quasi-Governmental Units, Oversight and Governance. In December 2020, Governor Hogan established the State Transparency and Accountability Reform Commission, otherwise known as the STAR Commission, which was charged with looking at a number of state instrumentalities that operate as quasi-governmental agencies. We looked at agencies such as the Maryland Stadium Authority, Medco, TEDCO, and the Maryland Clean Energy Center. We recognize that these agencies are designed to fulfill public purposes by operating with structures that provide the necessary managerial flexibility to ensure optimal performance. These agencies, while an arm of the state, often have a wide latitude of independence, but not a lot of government oversight. Under the leadership of former State Senator Andrew Serafini as chair, the commission worked diligently throughout 2021 to develop common sense recommendations to improve transparency and accountability mechanisms for these agencies. The commission released its final report December 1st, 2021, which had a number of recommendations, some of which are included in the bill before you today. Senate Bill 399 has 5 main parts, many of which may be familiar to the General Assembly because they were included in last year's MES reform legislation. First, each of the agencies listed would be required to submit an annual detailed budget to the Department of Budget and Management for inclusion in the budget books. This would include both operating and capital expenses and provide the specific source of their revenues. Second, each agency would be subject to a biennial legislative budget hearing, which would serve not only as an oversight mechanism, but also provide important information to the budget committees about the work that each unit is doing. Third, the legislation requires an independent board assessment to be conducted every 5 years. This assessment would ensure that they are operating in an efficient manner. The independent assessment would evaluate factors such as the structure of the board, dynamics and functions, the board's role in the agency's short-term and long-term strategy, the financial reporting process, internal audit and internal controls, the board's role in monitoring the policies, strategies, and systems, and the role of the chair of the board. Fourth, each governing board would be responsible for conducting an annual performance review of the agency's head. Finally, the bill will require DLS to perform a comprehensive review of each agency at least every 8 years. This review would include an analysis of an agency's statute and mission. Then the Legislative Committee of Jurisdiction would use the information in the DLS review to conduct a review similar to a sunset review. This review, unlike a traditional sunset, would not eliminate the agency if the enabling statute was not extended. The review would provide a great deal of oversight to the legislature. Given that these agencies are created by the legislature, the commission felt it was appropriate for delegates and senators to determine if the agency's statute needs to be amended or if the mission of the agency is already or could be achieved by other existing units. I want to emphasize that the DLS and legislative review that would occur every 8 years, that it is not our intention to negatively impact an agency's ability to issue tax-exempt bonds to finance capital projects. We don't want to threaten the status of their ability to issue and service bonds. Both the administration and commission recognize that these agencies provide important services to our state, but Governor Hogan strongly believes that we must do whatever it takes to restore honesty and integrity to state government and to ensure that the best interests of Maryland citizens are being represented fairly and honestly. This bill seeks to accomplish that goal. I know there are a few amendments that may need to be worked out for some technical fixes, and I look forward to working with the committee on those. For these reasons, we respectfully request a favorable report on Senate Bill 399.
Thank you, Ms. Chase. Senator Serafini.
Thank you, Chair Pinsky, Vice Chair Kagan, members of the committee. I'm here today in favor of Senate Bill 399. I was chair of this commission. You should know that we had all of the major cabinet positions were represented. We had private entity people that were with us, and then we had elected officials. We had Delegate Corbin, Delegate Shalega, we had Senator Egbert, and we had Senator Feldman, which was really, I thought was very great. I would say Delegate Corman knows this issue as heavy as anybody in the House and has done a lot of work with this. In fact, he has a bill, and Senator Feldman has it over here too. So if you'd read this report, you'd see there's many suggestions, and there's many, many more, but we tried to highlight the top 5, I would say. But I would say for a second, it would be good for us to consider a little background. I find it interesting that every culture, in fact, every world religion has their form of the 10 Commandments. My wife and I were able to go to France and visit the Louvre, and they have the Code of Hammurabi, which was written in 1750 BC, which is really the laws that were established in the Near East. And I think that's interesting if we understand cultures over time have had to set up rules and codes of conduct to help people live and understand what's expected of them. And that's the issue. Why do we need these laws and rules? Well, sadly for us, we've even had some of our fellow electeds over time that have run afoul of the rules, even though we all know what we go through for ethics training and things like that. So it was with that background that we took the time to try to examine these things. And I want to say first and foremost, Ms. Chase said this, we believe that quasi-government agencies are valuable. They really provide an excellent service, and they're very, very helpful to the citizens of the state. They are of different sizes and structure and purpose, but there are some common themes, and we think we've picked up the 5 that will really highlight and bring this to what I would call guardrails. We talked about that in the commission a lot. Guardrails are put in the safe part of the road to keep you from going into the unsafe part of the road. They keep your car in an area that's safe for you so that you don't get yourself in trouble. And that's the idea with what you're going to see in this bill. Now, if we think about transparency and accountability, the fact that they're going to have to come before legislative committees, the DLS analysis, DBM budget, those are great. But listen, as we looked at this and we had experts testify from various entities throughout the year, it is the boards, I would argue, that in some cases are the most responsible to make sure that the fiduciary responsibilities of handling the citizens of the state of Maryland's money and the money that is put into these, it's up to them to hold their employees, the people that are functioning in that, accountable. And I think that's why I really appreciate the parts that are in this that point to that. And they will be the ones that ensure these fiduciary responsibilities are there. Now, I want to say one last thing, and I'm going to try to finish early, which would be really a remarkable thing if you've known me for a time. But you know, nothing is going to be fail-safe. I think the idea is we're trying to do the best efforts here. This was a bipartisan effort. I think we all hopefully can appreciate that we had some really brilliant people. But the idea is this. If you get a chance, you ought to read Malcolm Gladwell's Talking to Strangers, right? He will tell you that it's amazing that we misjudge people often. We don't know how Prime Minister Chamberlain thought that Adolf Hitler was a good guy and he could trust him. We don't know how Bernie Madoff was able to fool so many different people, but it happens. And the reality is, even if you go back to Enron, I knew people that were in auditing them. And if two people decide to collude together, it's almost impossible to catch sometimes. So what we've tried to do in the Star Commission is build those guardrails, to build the rails that will keep people on it. And we've also said, if we can't do it that way, let's shine a light on what they're doing so that everybody has a chance to hold them accountable, understand what they're doing, and ask the tough questions, because that's what we're all responsible to do. And I believe this bill, with these 5 phases, in addition to Senator Feldman's and Delegate Cordman's work, will bring to light the best efforts we can to try to avoid some of these difficult situations we've seen. Very good to be before you all. Hope you all have a good day and a good rest of your session.
Thank you. Questions on the issue to either of the panelists? Let's start with Senator Riley.
Thank you very much, Mr. Chair. Senator Serafini, good to see you again.
Thank you.
I see the list on page 2. We got 2, 4, 6, 8, 10, 12, 13. So the bill's targeting these 13 organizations.
Current, right.
Now, do all of them receive state money?
I would say no. Some serve in a capacity where they consult or advise. You know, you have that sometimes, especially in environmental, where maybe you can't afford to have a certain thing. So most do, but not all.
So if they're not receiving money,
Right.
the purpose of this review is?
So there are monies and services that they provide. And we
Sure,
wanna make
like the Maryland Auto Insurance Fund.
Exactly, there you go. Great example. And we had a hearing with them specifically, so we could understand their functioning, how they work, and the services they provide. I want to say this to you all. I didn't know the quasis as a legislator for a long time. I didn't know why they were created. And some of these, we think these reviews, and Aaron said, well, if they're issuing bonds, we don't want to ever promise that, create a problem for that. But some maybe don't need to continue. Maybe some should go private, maybe some should come back under government. So that's the other reason is, are they still functioning? Are they still providing a service? And that would be the idea, to come before budget committees or DLS and have the reviews by the legislature.
The reason I pointed out MAIF is they came up just recently in a transparency bill, where we're not requiring them to record their meetings, publish agendas, or notes, and no video. Do you know if any of these 13 are currently required to be included in this transparency issue, where they have to be available for the citizens and the legislatures to kind of peek in under the curtain?
That was a component of consideration. I'll let Ms. Chase speak to that.
Yeah, so Senator Kagan actually has the cross-file to Delegate Corman's bill that actually came from some of these recommendations. So a lot of these entities are actually currently exempt from the Open Meetings Act, which is why you have Senator Kagan's bill before you. So I think we just are aiming to kind of make sure that these are all on the same level playing field with a lot of other state agencies. They may not function as executive branch agencies, but we think, the more sunshine, the more sunlight we can put on these agencies, the better. So Senator, thank you for that, or co-sponsoring that legislation.
All right, thank you. Thank you, Madam Speaker.
Thank you, Madam Vice Chair, and good to see you, Ms. Chase. And Senator Serafini, the testimony today reminds me of our days that we overlapped on House Appropriations Committee. And that's where my question is going. When I was going through the different steps, and right up front is the submission of the annual detailed budget, and then the legislative budget hearings. And Senator Serafini, given your experience being on appropriations and being budget and taxation, can you talk a little bit more about what you expect to come out of that front-end budget process?
Well, any of us that have been through a budget hearing, they're leaning on DLS often to really dig deep and come back to us. And that was interesting for us to be able to see them, ask them the questions, and dig deep. The reality is, if we looked at some of the things that have happened historically in the past, right, it was, are you using audits? I mean, there are many, many more recommendations what the commission put out, but we focus on these because we think these are the best chance to give legislators the opportunity to ask the questions, because budget hearings are pretty deep. And they're long. They're not as long as your guys' hearings that you have here all the time, but they're pretty intense. They really give the opportunities for us to ask the hard questions, because that's, in the end, ultimately our job.
And I would say not just the hard questions, but sometimes it's a question will come up and we have it occur around this table, that it's an interest of a member, but by asking the question, it sometimes opens up more questions. And so I just saw that not only the hard stuff, but also a way to just better understand what's going on in these quasi-agency, which a lot of us did not, are still learning about today.
Yes, thank you.
Senator Ellis and then Senator Hester.
Yeah, thank you, Vice Chair Kagan and Senator Serafini. Good to see you again, and Ms. Chase. You mentioned a commission that you were on to create these recommendations. So what's that commission?
It was the STAR Commission.
STAR?
STAR, yes.
STRT or?
STAR.
STAR, okay.
Yes, yes.
Is that an acronym for something?
Yes, it is, yeah.
So
Ms.
what is
Chase
that?
started
Ms.
it with
Chase,
that.
yeah.
Go ahead.
State Transparency and Accountability Reform Commission.
Okay, great, thank you. And is that a creation of the General Assembly or the governor?
Governor Hogan created it, I believe you said in 2020, so it was before last year. We met once a month, virtually. We did have legislators in the beginning, some of the ones that had been involved in the concerns that had been raised. They testified before us. We brought experts. Each of the agencies that she listed came before us as well, so we were able to ask them questions. So,
Okay, yeah, thank you for that.
sure.
And what was the impetus for the STAR agency? I mean, is there some light bulb that went off or some event that said, hey, we need this commission to?
So I would tell you, Ms. Chase can speak deeper to the governor's thoughts. From what I took from it, the governor was saying to us, listen, we've had some questions about MES, we've had some questions about other of these agencies in the state, and instead of trying to compress in the short period of time of a month or so that you all have to put things together, wouldn't it be better to take a year, really bring everybody together and see what we could do that could address these issues in the past? Now, frankly, there were some that wanted us to really get forensic with what had happened. But this has been—
What does that mean, get forensic?
To dig deep into the specific issues that maybe brought the idea for this. But my emphasis on this was to look forward, right? Mistakes have been made in the past. We all know what we go through, right? We all know the issues that we have with open meetings and the transparency such as meetings of this. And we said, how do we bring that to quasis? How do we bring some as we said, transparency and accountability, but without hampering what they do?
Okay, great,
And
thanks.
that was the goal of the commission.
Okay, great, thanks. And I noticed, I don't know if I missed it, but like University of Maryland Medical Systems, they're not on this list.
They are not a
So,
quasi-government.
well, they're not?
They are not.
What are they? How would you classify them?
They're a nonprofit entity that performs a lot of services for citizens of the state, and there's been a relationship, but they are not a specific quasi-government agency.
So you said they're private nonprofit?
Right.
So if that's the case, I'm always wondering, why do we confirm board members, we being the Senate of Maryland?
Right. I would say, I was not around, I believe Senator Neal was involved in the original creation of OMS. We do that because they do, they do partner, they do provide many, many very valuable services. They receive funds just as a healthcare provider in our state, not specifically other than for the service that they provide and partner with us.
Yeah, so is there a special, it seems kind of weird, so like University of Maryland Medical System, we confirm members to that board. We passed law, I think last year or 2 years ago, to reform the board. So, but I hear you say that we have nothing to do with them because they're private. That's kind of like...
Well, I wouldn't say we don't have anything to do with them. They don't fit the traditional definition of a quasi-government. I mean, at the federal level, it's Ginnie Mae and Fannie Mae. They provide loans to that. That one forms a structure because the government guarantees those loans. We do work collaboratively with UMS. That has a big question. There were some issues. There is the appointment, but for the most part, I'm sorry, did you want to?
Ellis, I just have
Okay.
to be in another committee, so
Okay.
when he's done.
Yeah, okay. Yeah, so, okay. So that's the issue that I guess maybe you could talk to, follow up offline to see why we have responsibility over them as a Senator of Maryland to confirm, and the governor appoints, we confirm, but yes, still, they're not included in this. So if you could follow up with me later, please, that would be appreciated. Thank you.
Thank you, Senator Ellis. And Senator Hester kindly let me cut in front of her here because I am being summoned now. Senator Serafini, it's great to see you back. You look well, and we're always grateful for your service, whatever that looks like. Ms. Chase, thank you for your leadership on this, and thank you for being here. I have a super quick question. I just wonder why the commission came up, two questions, actually. One, what was the vote of the final report and the sentiment about this legislation? And two, if I missed that, and how did you come up with the year 8? And are there other states, 8 years, evaluating and oversight and reports and stuff? So if you could briefly answer those questions, and then I have to run and pass it to Senator Washington.
So I think generally, Senator Serafini can disagree with me if I get it wrong, but I think all of our recommendations were adopted unanimously. And then when it comes to the 8 years we chose, we kind of were thinking maybe once every term, every 4 years, but we thought that might be a bit of a heavy lift for DLS, so we decided to change it to 8, thinking that maybe that would give them a little bit more time to be able to do their regular DLS duties during session, while also maybe adding a couple of these quasi-agencies into it. But the bill's before you guys now, so if you guys wish to change that number, I'd be happy to have conversations about that.
Good to see you, Senator.
Great, thank you. Hello, everybody. Good to see you again, fellow colleague. Senator Hester, before we go to you, I just want to follow up on Senator Ellis's. Maybe it would be helpful for a definition of quasi, because I'm not sure everyone knows. If there's a quick sort of bullet point, 3 things that describe
So
what
I'll take a
quasi-
run at it, and I'll try to give you how I understand it, right? So, and it's probably more about their formation. So typically, there is a need for something to be done. You need to build a stadium for the Orioles and the Ravens, okay? And there was a thought of the legislature at that time is, I'm not sure where exactly that would fall within the current confines of government. So let's create an entity. We wouldn't want it to be fully private, but we would want, because we would want some control. So quasi-government agency, Maryland Stadium Authority. All right, so they have some components that looks a little bit governmental, but they also operate and work as more like a private company, sometimes for speed, sometimes for, issues of interacting with different groups and management beyond that, that it felt typically by legislature that this would be a way, an approach that's done. Once again, when you look at the federal, they did it with certain agencies when they wanted to create loans for veterans and for farmers' home folks. So there's a specific need. It doesn't seem to be clearly traditional government, but there's reasons why it shouldn't be fully private.
Right.
And that's why quasi-government comes as a kind of a marrying together of the strengths of government and the strengths of private into an entity.
And this would be codified, this is in code, so the relationship, what it is, these
Right.
institutions
Yeah.
that you
Yes.
identified.
And that's what we said. Each of these does different entities, right? Some, the canal place up in Cumberland, hey, we need this to be run, but how do we want to do it? It was formed in the specific legislation itself, and I think that's why the 8-year review is good too. Not to be a sunset, but this is what we originally intended. Now, the Stadium Authority has gone beyond stadiums now, right? They help build schools because they do good things. So that's always an issue for the legislature to be able to revisit and say, is this still functioning? Are we asking them to do things outside and understand it? And I think that's what we tried to say is, what are the components of all these big, Stadium Authority, millions and millions and millions, and some of the other
Absolutely.
groups are very small.
Yeah.
But how can we create something where there's confidence in the legislature that they're doing what they were originally intended to do by legislature, and they're keeping the sacred trust of the public to do that?
And the possibility is that maybe some, as you said, could roll back into government and
Right.
no longer. Great, thank you. Senator Hester.
Thank you, Madam Chair. Senator Serafini, it's wonderful to see you again. Thank you for making the trip.
Sure.
My question, which you don't have to answer now, is that out of these quasi-governmental agencies, do you know if they all ride or some of them ride on the Network Maryland, our internet service provider?
That I don't know. I'd have to check.
Because when we do these audits, we often find, whether one of the things they look for is violations of personally identifiable information. And so it seems like, every agency has them. So it would be another reason, I think, to bring them into the fold, particularly if they ride on the state's network.
I will say this just real quick, and Aaron, I don't know if you wanted to respond to that. Let me say, one of the problems is some of these are very small. They do a very specific function. Maybe they only have 2 or 3 or 10 employees. So that was a big thing when we're talking about audits and hiring outside independent auditors and stuff. So we're trying to think about, and this would be something for the legislature to conceive as well, can we create a pool so that small groups that maybe couldn't afford that could share in on a larger entity? And I'll let Ms. Chase respond as well.
Senator, I'll follow up with you on the agencies that might be on the network. I don't have that offhand, but happy to follow up with you.
Great question, Senator Hester. Senator Lamb.
Sure, thank you. Good to see you again, Senator Serafini. Quick question, I apologize, I might have missed this in the presentation earlier, but with the entities that were identified here, there are other entities that are, I guess, maybe quasi or close to quasi-governmental that also have boards that are, say, appointed by the administration and confirmed by the Senate, not included on this list. And maybe you can explain why those weren't included here, and also just touch on the criteria that you used to incorporate these into the piece of the legislation here.
So the original legislation did name these entities, but it did give an option to the commission to go further, as you say. What we were trying to do was not necessarily identify or work and look at individuals. We were trying to pull back and say, can we, by using this as a sample, find the issues that are common, that maybe are open for issues or have historically created problems, and can we build framework that would work whether they were on that list or not? So that for us was a decision that we kind of made early on, is we would live within the ones that the governor had originally named, and we would look at them and spend the time digging deeply with them, understanding that whether there were others that were out there understood, or there may be ones in the future, can we write something that will have the ability to address concerns, whether present, whether the group that we reviewed, or possible future ones.
So these were ones that were originally named, I guess, and
Yes,
that's why they're
that's
included in
exactly-
here?
Yes.
So this is not meant to be a comprehensive list in any way, then? Okay, all right. And I guess if this were to move forward, then there would be ability to expand this list or broaden it to include other quasi-governmental agencies and the like. Because I guess in looking at this, and I've always had a concern with the University of Maryland medical system, where they seem to utilize the connotation of the state and as an extension of the state when it's convenient to them, but then not necessarily when it's not convenient to them. And in some of these instances, some of these entities may be doing the same, where it allows them to have a little bit more nimbleness, for example, in hiring and being able to be more responsive to clients and et cetera, et cetera. But then, they clearly have Maryland in their name, seem to connote an official kind of designation by the state. And so, things like University of Maryland Medical System, I'd be interested to, consider for this list too. But I understand that this is not meant to be comprehensive, so. All right, thank you.
Thank you. And it does look like we need to further explore truly what the definition is of quasi, not quasi-independent and separate, because the assertion was that somehow that the medical system is a separate nonprofit, but you are correct in terms of at times it seems like it is and at times it isn't. So thank you for that. I don't see any more questions. I think that's the bill hearing. Thank you so much.
Thank you.
And thank you for this good work. This is the end of the hearing on SB 399. Next is another administration bill, which is SB 398. Am I correct? This is out-of-state healthcare practitioners, provision of behavioral health services via telehealth. It's authorization. I believe I have Jake Whitaker. Are you testifying on behalf
Correct.
of the administration? And I have, I'm sorry, trying to see who else. Is this Aaliyah Jones?
This is she.
Is also testifying? Great, the Behavioral Health Administration. And just in time, I will pass off to our chair.
Welcome.
Great. Thank you, Mr. Chair, members of the committee. My name is Jake Whitaker with the Governor's Legislative Office, here to testify in support of Senate Bill 398. I'm joined by Dr. Aaliyah Jones, the head of the Behavioral Health Administration at the Maryland Department of Health. Since taking office, Governor Hogan and Lieutenant Governor Rutherford have remained committed to addressing the heroin and opioid epidemic, including expanding access to and reducing barriers to critical behavioral health and substance use disorder services. Senate Bill 398 allows out-of-state practitioners to provide behavioral health services to Marylanders via telehealth. The COVID-19 pandemic has only increased demand for mental health and substance use disorder services. To be clear, this bill is not aimed at undermining or interfering with any interstate compacts. We simply want to create a pathway forward for providers in states not participating in compacts to be able to serve Maryland patients. We applaud the boards for the hard work they've done to implement the different compacts. In fact, one of our administration bills last year was the Professional Counselors Compact. However, we're limited because if states do not participate in the compacts, the healthcare licensees cannot serve patients here in Maryland from those states. For example, only 2 states so far are participating in the Counselors Compact, that's Georgia and Maryland. Maryland can be a leader in maximizing the number of providers available to patients by allowing out-of-state licensees in states not participating in compacts. So for the aforementioned reasons, we respectfully request a favorable report on Senate Bill 398. And if okay with you, Mr. Chair, I'd like to turn it over to Dr. Jones. Thank you.
Good afternoon, Chair Penske and committee members. I thank you for this opportunity to support and testify in support of Senate Bill 398. My name is Dr. Aaliyah Jones. I'm the Deputy Secretary for the Behavioral Health Administration and the Maryland Department of Health. SB 398, as Jake mentioned, seeks to allow out-of-state providers to provide behavioral health services through telehealth to Maryland residents while still abiding by all applicable Maryland state laws regarding the confidentiality of health information and patients' rights. One of the values underpinning the Behavioral Health Administration's mission and activities is having a responsive system. The behavioral health system of care must be responsive to the people it serves, coherently organized and accessible to those individuals needing behavioral health care. Information must be readily available for individuals to enter and proceed through the system in a more appropriate and in a timely manner. In 2019, we performed a statewide workforce survey of behavioral health administrators and clinical staff. And what we heard resoundingly was that there was an inadequate supply of providers in the workforce, and COVID has only made workforce issues that much more challenging, as you all are well aware. And the behavioral health workforce has not been hit any less than any other industry at this point in time. So this bill will provide for the expansion of services by improving patient access to healthcare practitioners and communities experiencing a healthcare practitioner shortage. Across the healthcare industry, as I mentioned, there's a shortage. And I have a friend of mine who's in private practice, who's a child psychiatrist, who told me that he's taking appointments a year out for new appointments at this time. So there clearly is a great need to increase or expand our availability to providers at this time. And this legislation would allow us to do that. And it would also increase the types of providers that patients would have access to if they are specialists outside of the state of Maryland that they would like to reach. And so with that, I say thank you for your consideration of this legislation.
Thank you, Doctor. We have 2 other speakers favorable, one other. Josh Howe, you want to join us then? We'll take questions, then we'll go to the opponent.
Good afternoon, Mr. Chair and members of the committee. My name is Josh Howe with Compass Government Relations here on behalf of the Maryland Association for Justice. Respectfully asking for a favorable with amendments report on SB 398. A portion of the bill in SB 398 has to do with holding these out-of-state practitioners accountable, and it discusses the choice of where a venue for an action may be brought against an out-of-state practitioner. That section is outlined in section 1-1005 B6, beginning on page 3, lines 16 through 23. So as drafted, the venue for civil action is currently limited to the patient's county of residence or any county in the state in accordance with section 6201 of the Courts and Judicial Proceedings article. The MAJ would assert that limiting venue limits access to justice, and this is not how torts that are brought in state against in-state practitioners are handled. So MAJ would respectfully ask that in addition to Section 6201, that you add the words, or add the number reference, Section 6-202, which would also bring in, which would level the playing field for the types of actions that can be brought against out-of-state practitioners, and includes other options for venue under that 202 portion. Happy to take any questions.
Thank you. Questions, committee? Senator Carrozza.
Thank you, Mr. Chair, and thank you for this bill. Given that I represent a district with Delaware bordering to the north and Virginia bordering to the south, and I have worked on other compact bills last session, especially with the pandemic, on occupational therapists and alcohol drug counselors. I wanted to see with this particular bill, obviously focused on behavioral health services through telehealth, what you thought, and I'm looking at kind of the impact on my district, given that I'm a basically border district.
So Senator, thank you for the question. I think that's a perfect example. So for example, the state of Delaware does not participate in the Counselors Compact right now. So because of that, this bill would allow licensees from Delaware to be able to serve Maryland patients. So although we support the compact, we want to advance it, we want all the states to participate in it. Until they do, those licensees can't serve Maryland patients, so this bill would be a vehicle for that.
A more immediate vehicle instead of waiting for all these states to come online?
Exactly. So while we're waiting for that, or if a state doesn't choose to, a licensee from that state could serve Maryland patients.
Okay, thank you very much.
Thank you.
Further questions, committee? I'm sorry, Senator Lamb. Sorry.
Yeah, thank you, Mr. Chairman. I'm just trying to understand, this seems very broad. I mean, this committee, has jurisdiction over health occupations compacts that come through as legislation, and we take a very close eye and scrutinize all of these compacts as they come through. This one seems to be missing some basic things that we would require out of other compacts, things like how do you report back to complaints about an out-of-state practitioner, or it doesn't even have some basic requirements for states that might have less stringent requirements than another state like ours. And so, different states have different health occupations levels. So for psychologists, here in Maryland, it may be a PhD. In other states, it may be a different degree. It doesn't address any of that and paints very broad strokes in that. And I'd like to hear why that is.
Sure. So there's two answers to that. The first is that there's language that says that any practitioner who serves Maryland patients here has to follow all the applicable Maryland statutes and regulations. We thought by having broad language, we'd give each of the respective boards broad latitude to implement processes to address some of those concerns that you mentioned. I would say additionally, we've been working with the Board of Physicians, and I spoke to them about specific language addressing that concern. For example, a registration process. So we are considering some of those concerns, and we've heard it from the stakeholders, so we definitely want to address that.
Because by extension, it seems like this just bypasses every single board.
It does not. So they would have to follow the board rules. They would also have to follow any processes that the boards would implement subsequent to the passage of this legislation. And like I said, we're working with some of the different boards to implement some language to make sure that there's a registration process to address some of those concerns, sir.
So I am concerned that it is overly broad. There's no kind of time duration to it, that it really kind of upends a lot of the authority of the boards that have already been set up, and also some of the careful scrutiny that this committee does in terms of compacts or interstate kind of licensing agreements that take place. Mm-hmm. This piece of legislation, I think, has concerns that I have when it comes to just painting very broad strokes and a lot of loopholes here that are not being addressed. And so, isn't that so? You probably disagree, but thank you, Mr. Chairman.
Thank you very much, Mr. Chair. Dr. Jones, it's good to see you again.
Good to see you.
Thank you for being here. I was just curious, from the average, citizen who's not tracking what's going on here, if they wanted to receive telehealth from somebody outside of the state, how would they know that that's not a good thing to do right now?
I don't think that they would. I think that if you're looking for a provider in the various ways that people look for providers, you would really have no idea where a provider was serving you from or whether it was okay or not okay, even right now.
That's what I'm saying, is like, to the good senator's point, like, this is very broad and seems to bypass the boards, but I kind of think that in practice, it may be happening anyway.
Very well may.
Okay, thank you very much.
Further questions? Seeing none, thank you all. Let's go to opponent, Mr. Tiffin.
Thank you, Mr. Chair. My name is Scott Tiffin. I'm here on behalf of a variety of folks that are in my written testimony, but including the social workers, as well as the occupational therapists, the licensed professional counselors, and the Maryland Nurses Association. We have a lot of concerns about how this bill is structured and go into much more detail in our written testimony, but I wanted to highlight a few high points that maybe we're most concerned about. One was already talked about a little bit, and that's the lack of a registration or any real process for our boards to track folks. If I was seeing a social worker who was from out of state and I had an issue with them and I called the board would have no way to know who that person was. And so unless I happen to have that person's out-of-state contact or whatever, the board might not be able to follow up and do any type of discipline with that provider. The other question that we've gotten is we've talked to a lot of the boards, and they're not really sure that this bill gives them the authority to use all the disciplinary tools that currently exist, because a lot of the disciplinary tools are tied to your license, whether it's taking your license away, suspending your license, things like that. So they're not exactly sure if this fully allows them to use all those same tools. The last thing was kind of mentioned already, and that's about compacts. And this committee has done a lot of work on compacts, including the OT compact that Senator Carrozza worked on a lot last year. And it's just a little bit unclear to us how this bill interacts with compacts and the obligations that different states have under compacts. So we just feel like there probably needs to be a lot more interrogation about how this works with the compacts. So overall, we're just really concerned about patient safety here, and we just would ask for a favorable or unfavorable report, but I'm happy to answer any questions that people might have.
Question for Mr. Tiffin, Senator Carrozza.
Thank you, Mr. Chair, and thank you for your testimony. And given I think we have a shared goal here, you would be willing then to work on the bill and some of the issues that you addressed?
Yeah, most definitely. We're always happy to try to figure out a way to increase access for patients.
Thank you.
Okay, before we end this hearing, I would point out, and I don't know where your interests lie in understanding the testimony, but there's a lot of unfavorable written. They haven't appeared before us, including the Psychological Association, MedKite, Shepherd Pratt Hospital Association. So you should read that. I'm not presenting that as supporting or opposing, but you should check the file on this. There's a lot of controversy. Anyway, be that as it may, no other questions. Thank you, Mr. Tiffin.
Thank you.
That concludes the hearing on 398. We have Senator West before us. This is Home Improvement Commission award limits. We have Senator West and Eric Johnson. Mr. Johnson, if you want to come up with a good senator. After that, there is no other opposition on file, either orally or written. Then we'll go to good Senator Egbert from the Middle Shore. Senator West.
Thank you, Mr. Chairman. This, I suspect, will be the simplest bill that you received the entire session. The bill proposes to make a change to a single number in the Maryland Code. So, under current Maryland law, a homeowner may recover compensation from the Home Improvement Guarantee Fund for an actual loss that results from an act or omission by a licensed home improvement contractor as found by the Maryland Home Improvement Commission or a court of competent jurisdiction. Following a valid claim under current Maryland law, MHIC may not award from the fund more than $20,000 to one claimant for acts or omissions of one contractor. This bill simply raises the maximum possible amount awarded by the MHIC from $20,000 to $30,000. The maximum amount permitted from the guaranteed fund hasn't been raised since 2008, and inflation since then, of course, has been significant, not to mention the current inflation, which is quite significant. Furthermore, the MHIC fund has a balance currently in excess of $3 million. So there's enough money in the fund to pay an extra $10,000 in the more serious claims, the maximum amount of the claim hasn't been increased in 14 years. So this bill would simply increase the amount from $20,000 to $30,000. I appreciate your attention and would be happy to answer questions and hope for a favorable report.
Senator, I apologize. What was that figure currently in the fund?
$3 million, I'm told.
Okay. Mr. Johnson.
Good afternoon, Chair and members of the committee. My name is Eric Johnson, and I'm here in support of SB 467. I hired a contractor to do an addition on my home. There were 21 building code violations found by a judge. Each of these building code violations threatened the health and safety of my family and reduced the value of our home. When I demanded repairs, the contractor walked off the job. Instead of doing repairs, he sued me to force final payment of the contract and placed a lien on my house. I countersued, and a jury awarded me $130,000 after I spent $200,000 on legal fees. The contractor declared bankruptcy, and I got nothing. Shortly after the contractor sued me, I filed a case with the MHIC. They refused to do anything. They said they wouldn't do anything until the court case was over. 7 years later, after my victory in court, the MHIC said I still had to go to an OAH hearing to make my claim. This violates the legal principle of res judicata, which is enshrined in the 7th Amendment of the Constitution. This says that any case that has been decided is barred from relitigation. I had to take a month off of work, and I was attacked in the hearing at the OAH by a lawyer for the MHIC who did everything she could to keep me from getting a single penny from the guarantee fund. In spite of that, I got a judgment from the OAH of $66,000. After waiting 16 months, I received $20,000 from the guarantee fund. Obviously, the $30,000 allowed under SB 647 is an improvement, but it is woefully inadequate. The DLLR requires contractors to have assets equivalent to the maximum payout of $20,000. The DLLR claims that an increase such as this would make it too difficult for contractors to get a license. But I'd like to mention that the overall limit for one contractor is actually $100,000. Why does the DLLR complain about a $30,000 limit, but is happy with the overall $100,000 limit? Is there any evidence that a company wouldn't pay $30,000, $40,000, or even $100,000 to keep their license? If they don't, then homeowners would be better off without them having a license. The MHIC is sitting on a pile of money that they would rather keep than give to people like me who have been devastated by contractors. The bill we are considering today
Mr.
is not...
Johnson, you're going to have to wrap up.
Well, there are a lot of other problems with the MHIC, which I submitted in my paperwork. I thought I was going to get 5 minutes, but the MHIC does everything it can to fight homeowners and to help contractors, and this needs to be investigated. My contractor never paid a penny back to the MHIC, violated all these things, and he's still operating in the state of Maryland. The MHIC took no steps to even investigate him. They don't want to investigate contractors. They don't want to do anything. They just tell you, file your claim 7 years later, see if you get some money, and then maybe you'll get it. In the meantime, we have contractors like my contractor who is doing work today on people's homes even after he said in court building codes are BS. This is a contractor who's building not according to building codes, and he's still operating in the state of Maryland, and the legislature should do something about reining in the MHIC, which is not doing its job at all.
Thank you, sir.
So please read my statements to find out what's really going on with the MHIC.
Questions for the good Senator West or Mr. Johnson? Just one very quick one. if one were to receive only a partial recompense for what was awarded, can you pursue civil litigation?
I did pursue civil litigation. I won a $130,000 judgment, and the contractor declared bankruptcy.
Okay.
Then I
Okay.
went to the MHIC to try and get my $20,000, and the MHIC fought me every step of the way.
We heard that, sir. Thank you. I just didn't know if the MHIC gave $30,000, if you could go for the difference through court. And
The MHIC won't even give you a hearing until you've finished your court case. The
Okay,
contract-
okay. Thank you.
contractor can
I got
delay all
the
this.
answer, Mr. Johnson. Thank you. Further questions? Seeing none, and there's no opposition to the legislation. Thank you, Senator West.
Thank you, Mr. Chair.
Johnson. Thank you. That concludes the hearing on 467. Senator Egbert, this is home improvement contracts, deposits by financial institutions. Should be followed by Brian Gambarini and Sarah Price. And again, okay. 855, correct. Thank you.
Thank you very much, Mr. Chairman and members of the committee. Senator Lee Egbert here, District 37, to present to you Senate Bill 855. And first of all, I apologize if you have a copy that went to Finance instead of EHE. You should have a corrected copy of my testimony coming around. And I'm grateful for the witnesses who are here with me today. The current business regulation for home improvement contracts does not currently require for a deposit to be made by a home improvement contractor if the project is financed by certain financial institutions. As a result, financing options can expire if they are not acted on prior to the start of the construction by the home improvement contractor. This bill changes the statute and adds a provision to allow a home improvement contractor to collect a deposit of up to 1/3 of the amount of the contract if the project is financed by a financial institution, one of the larger ones. Requiring a deposit ensures that the customer will maintain access to store financing options and ensures that the financing options will not expire. This bill will ultimately improve the ability of citizens of Maryland to access affordable means of home improvement options while ensuring that the contractors are paid for their work. As you may know, a lot of times people go ahead and establish contract, but without any financial obligation, folks renege, and then the contractor is not able to proceed or has already purchased materials, and then is left with those materials and that outstanding debt. I have to say my son's in this business, and he's gotten burned several times, so I appreciate that this piece of legislation has come to me. So I ask your favorable consideration and passage of this change in the law. And I would like to turn it over to Brian Gambarini first. Thank you.
Thank you, Senator, and I appreciate you bringing this bill forward today. Members of the committee, Chairman Pinsky, my name is Brian Gambarini. I'm the Senior Manager of State and Local Government Relations at the Home Depot here in the Mid-Atlantic region. On behalf of over 8,000 associates across the state of Maryland, I'm here today to voice support for SB 855, legislation impacting business regulations on home improvement contractors. Several members of this committee have heard a similar bill like this in past years regarding the partial pay statute. But after getting feedback from you all, from other stakeholders, from the Attorney General Office, SB 855 is a brand new approach that keeps the current protections in place. What SB 855 does is it addresses the financing of these projects and increases access to credit when planning for these projects, critical projects at Marylanders' home. I'd like to reiterate that this bill does keep the current partial pay regulations for customers and contractors and instead targets improving access to financing options for customers. Improving access to credit and financing helps the Maryland consumer. According to the Bureau of Financial Protection, good credit means access to better financial products. And 1 out of every 6 adults here in Maryland are credit constrained. This bill opens opportunities for Marylanders to take advantage of the variety of financial products that retailers like the Home Depot offer through reputable financial institutions. It allows Marylanders the chance to finance the full cost of their project at the current start. And especially right now, when customers are spending more and more time in their homes and on their homes, this really opens up financing options that they can take advantage of. Under the current law, as the senator referenced, only 1/3 of the project can be financed at project signing. The remaining balance financed at a later date, typically at project completion. Between those times, customers' financial situation can and does change. Circumstances like an unforeseen emergency, car trouble, childcare expense can impact the customer's ability to receive the same financing options at the remainder of the cost of their project. That's why we are supporting this provision today. The partial pay statute has created a patchwork of regulations on how that impact our associates and how they serve the customers here in Maryland and the surrounding areas. While we understand that there's not a lot of understanding for within this body to take away all the protections associated with partial pay, that's why we believe that loosening the financial regulations like this bill does today will improve customer service here in Maryland. Thank you for your feedback. I look forward to hearing any questions and ask for a favorable report on SB 855.
Thank you, Mr. Chair. Good afternoon, honorable members of the committee. My name is Sarah Price, and I'm here on behalf of the Maryland Retailers Association in support of this legislation. As was noted before, we've come before you in the past to support loosening partial pay laws, as they were largely put on the books to protect consumers from fly-by-night contractors who practiced in the past. But based on modern home improvement store models, this is largely not occurring. So, while we do understand the intent to continue protecting consumers and maintaining partial pay laws, we do believe that this legislation would help to ease cash flow for projects, make it easier for Marylanders to get work done on their homes and to get projects completed in a reasonable amount of time. I would be happy to answer any questions, and we would urge a favorable report on this bill. Thank you.
Yeah, Mr. Gambarini, let me ask you a question.
Yes, sir.
If this would require, if it's financed, to be paid in full to the contractor, what incentive is there for the contractor to complete the work in a timely fashion? I mean, my experience has been, you pay a third at the front, third in the middle, and third at the end, or some variation on that theme, because they want their money. And if they get it all up front, I'm trying to understand how the homeowner who wants the renovation can feel confident it's not going to drag on for an additional 4 to 6 months.
Yes, Mr. Chairman, if I may respond to that.
Please.
Yeah, there is an incentive for the contractor, and again, I can't speak for all contractors. I can speak for the Home Depot, though, sir. And our incentive is a couple pieces. Number one, we're a customer service-based company, and taking care of the customer is our number one top priority. So we're number one, we're not going anywhere. Our store is always going to be there. And number two, taking care of the customer is critical. So if a customer does sign a contract with the Home Depot, we have an incentive to do that. And then also,
I'm going to interrupt you.
Okay.
We're setting policy. Look, I understand that, and we know where to find you. I think that falls under, you got a big store. And plenty of lawyers, but that's another story. But we're setting policy for the state, for every contractor, every Tom, Dick, and Harry responsible, and unfortunately the few who aren't responsible. We've got to decide what is best if we're protecting the interest of the consumer. It's not always Home Depot we're dealing with. So if you can, respond to a statewide policy.
Yes, sir. I'd be happy to. The difference between what has been brought forward in the past and what this bill 855 does is the specific reference to the financial institutions and being able to finance 100% of the cost, and that being the only piece that this bill touches. Because when you're working through a reputable financial institution, whether it's a bank, whether it's a credit union, whether it's another financing object, those industries are very highly regulated. And whoever the retailer is, and for example, Home Depot, we have an obligation, but we also have a responsibility to be reputable for our financial products. If we don't take care of the customer, we don't service their contract that they've signed, then those financing options are not going to be made available to the Home Depot. And in turn, sir, we're not going to be able to make them available for the customer. That's where the incentive lies for, as you said in your example, where that incentive is. And again, for the financing piece of it, which is the only thing that this bill touches, if we do not hold up our end of the bargain, when I say we, I mean a Home Depot, if we don't hold up our end of the bargain, then those financing options are not going to be made available to the Home Depot from reputable financial institutions which are regulated by tons of laws that even go beyond here in the state of Maryland. We will not have those products to be made available to our customer, and that doesn't make us a good customer destination. So I hope that's helpful, sir. That's where that incentive lies.
Thank you, Mr. Chair. So could you give us just like a really practical example? Like if I went to Home Depot and I wanted to redo my kitchen, what kind of financing options are you talking about? You're not asking me to pay more than 30%. We're asking to finance the whole thing at one time. What exactly does that mean in practice?
Yes, ma'am. I'd be happy to answer that. I'll try to make it very, very clear and very direct for you. So under current practice right now, the current regulations here in Maryland, if you were, for example, to go to Rockville to our Home Depot Design Center, it's a one-of-a-kind facility. There's only one outside of Rockville that's in San Diego, California. When people go and finance the kitchen that you could buy there, for example, those are large projects. I mean, I'm not going to be frank. I'm not going to blow anybody's mind when I say sometimes it's a $100,000 kitchen, for example. That ability to finance that project, under current law, you could only finance $33,333 of that. And what that does is there might be 0% financing for 24 months, whatever those product offerings are. What this bill allows you to do is finance the entire cost of the project. And if something happens down the line, your financial situation changes, you know that you've locked in that financing rate at the moment that you purchase that kitchen, for example. That's the practical example of where this bill addresses.
Thank you, and thank you for this bill, and thank you for the explanations, because I think we are trying to understand what's come before us before. My question is directed to the retailers. So I'm trying to get a sense of, in my district, with the smaller business-type contractors, you referenced, some anecdotes, but I didn't know whether between the retailers and NFIB, there were some numbers of, how this is impacting. And I also wanted, for the retailer, since you referenced it in your testimony, that you can probably do both. You can probably provide a little bit more protection for the contractors, but you would still have your consumer protections in place. Can you talk about that balance?
Absolutely. So our expectation for the impact that this could have for smaller contractors is that for a small contractor that may not have the type of cash flow that Home Depot has, if they are only able to, receive a third, and a third, that could hold up the progress of a project, especially if it's a very large, involved type of renovation that may have a lot of moving parts happening at once. So by allowing that contractor to receive a larger deposit from the get-go, if it's a particularly type of financed project, they have more money to get started. They're able to, order in more things, get the renovation scheduled and really get underway without having to worry about, we can only get this much done right now, and then when they get us the next check, then we'll get to the next part. They're able to really get started and get moving through the project, which works out better for the homeowner because they know that they have the schedule set out ahead of them. They know that the contractor is going to be able to get moving as soon as they have the supplies in and their project can get done efficiently.
Do you think the bill would help also, since there's been supply issues during the pandemic? Do you see that could also help in that area as well?
Yeah, I do think so, especially, if there are certain types of materials that are not, readily available now as they were 3 years ago. The contractor would have the funds available to order those items when they are available, even if, say, they weren't going to start that portion of the project for another 3 weeks. If they know they can get those materials right now, they have the funds to order them.
Thank you, because that's what I've been hearing about the supply problems as well. Thank you.
Thank you.
Sorry, any further questions for this panel? Senator?
Just, if somebody could get back to me and explain why it's different than financing a car, that would be helpful. Thank you.
Let's get back to the good senator at some point in the very near future. Okay, hold on, is there any, no one to sign up in opposition? That concludes the hearing on 855. Thank you, Senator Egbert.
Thank you.
Thank you.
Okay, okay, Senator Washington, I was going to do your short one. Yes, 869, is that okay? Or not? I can go to we have 4 bills in cybersecurity or cyber. I was going to deal with them. So I'm just trying to figure out an order here. Okay. Hold on. Senator Hester, do you care if we take the administration's bill in this first or not? Okay. Yeah, I just meant, I haven't looked at the specific details, but it's in the same topic. I don't know if people are testifying on multiple bills or not. Okay, well, anyway. Ms. Chase and Mr. Stewart on 390.
Good afternoon, Chair Pinsky, members of the Senate Education, Health, and Environmental Affairs Committee. It's great to be before you again. My name is Erin Chase with the Governor's Legislative Office, here to ask for your favorable report on Senate Bill 390, State Government Information Technology Cybersecurity. With me today is Chip Stewart, the state's Chief Information Security Officer. First, I'd like to thank the chair and committee members for working with the administration in the past to pass important legislation related to cyber and data privacy. In today's growing digital age, cybersecurity has become more important than ever. We live in an era where new technology is emerging every day and where there are more malicious actors than ever trying to gain access to sensitive information, networks, and critical infrastructure. Recognizing the urgency needed to protect the state's digital assets, Governor Hogan issued an executive order in 2019 to create the Maryland Cyber Defense Initiative, which established the Office of Security Management, the State Chief Information Security Officer, and the Maryland Cybersecurity Coordinating Council. These 3 elements make up the Maryland Cyber Defense Initiative and create a collaborative and comprehensive effort that works tirelessly to identify vulnerabilities, mitigate any potential threats, and strengthen the state's defenses, all of which ensure that our assets are protected and secure. Modernizing our cybersecurity defenses and securing all of the state's networks remains a top priority for the Hogan administration. The legislation before you today simply seeks to codify the executive order to ensure that our cyber structure, strategy, and framework are set in stone. In fact, this committee passed an almost identical version of this bill last session in Senator Hester's bill. Additionally, the cybersecurity bills you heard or will hear from Senator Hester later also seek to codify the Maryland Cyber Defense Initiative executive order. There have been many different pieces of legislation introduced this session that address various aspects of cybersecurity, and we look forward to working with the committee on this important issue. For those reasons, the administration respectfully requests a favorable report on Senate Bill 390.
Let's go to Mr. Stewart.
Thank you. Good afternoon, Chair Pinsky, Vice Chair Kagan, and members of the committee. For the record, my name is Chip Stewart. I'm the State Chief Information Security Officer for the state of Maryland. As you know, cyber threats are increasing on a daily basis throughout the world, especially given current events. in an effort to strengthen the state's cyber posture while solidifying its ability to manage and minimize the consequences of cyber disruptions. In the summer of 2019, Governor Hogan signed the executive order which created the Maryland Cyber Defense Initiative. In this effort to create a unified statewide cybersecurity program, the Maryland Cyber Defense Initiative created my position, the State Chief Information Security Officer, the Office of Security Management, which I lead, and the Maryland Cybersecurity Coordinating Council. Senate Bill 390 codifies the executive order into law. My role as the State Chief Information Security Officer is to protect the confidentiality, integrity, and availability of Maryland information systems and state-owned data. In this effort, I lead the office in directing and coordinating and implementing the overall security strategy and policy for all state agencies in the executive branch. The Maryland Cybersecurity Coordinating Council, or the MCCC, provides policy-level guidance regarding the implementation of cybersecurity program, as well as working alongside internal and external stakeholders to provide recommendations to help build, sustain the capabilities necessary for the state to identify, protect, detect, respond, and recover from cybersecurity-related risk. The MCCC is comprised of state officials representing numerous agencies and departments throughout the state. Having high-ranking officials from numerous agencies is a huge asset in working together to coordinate cybersecurity throughout the executive branch. The bill also requires the legislative and judicial branches of government to certify that they are meeting minimum security standards to be on the Network Maryland network. The chain is only as strong as its weakest link.
Questions for Ms. Chase or Mr. Stewart? Okay, we don't have to hit a light unless you want to. Senator.
I just would like to thank the administration for working collaboratively for the past year on cybersecurity issues. You've been instrumental in working on the study together, and appreciate you guys being here to present this bill. Thank you very much.
Thank you.
Thank you all. That concludes the hearing on 390.
Thank you, Mr. Chair.
Thank you.
Okay. So you want to do your short one? Okay. Let's go to small box discount store zoning requirements and community agreements. I have Senator Washington and Diana Emerson.
I have a PowerPoint. Is someone supposed to? Okay. Yes. Ah, great. Okay, all right. Because I could do it, I guess. Oh, so she came and then left. Okay. All right, sorry.
It's okay.
Oh, there she is. Maria. There she is. It's actually a really great PowerPoint. We spent time waiting for it.
You expect no less.
I didn't want Senator Ellis to be the only one to do PowerPoint, so we thought, oh, and he's not here to see it. Okay, great. Good afternoon, everyone. I am Senator Mary Washington. It's good to see all of you here. I respectfully urge you to vote favorably on Senate Bill 869, which regulates small box discount stores in Baltimore City. SB 869 would authorize Baltimore City to regulate the concentration of small box discount stores and provides a mechanism for residents through their community associations to have meaningful involvement in the economic and development process. Next slide. So we know that we've had a great deal of economic disruptions, COVID, and that our brick and mortar retail stores are having a potential impact for this. And also, we just know in general, patterns of consumerism has changed. And so I'm arguing here that Maryland should prioritize and support family-owned and independent businesses in order to help stabilize and grow our local neighborhood-based economies. When local communities imagine economic development, they're often picturing like healthy mix of Main Street businesses, grocery stores, restaurants, and services. However, over the last 5 years, small box discount stores, known as dollar stores, are proliferating. We really believe that this is not just a Baltimore problem, it's a Maryland problem and a national problem. Next slide. Now, it's been in the press a lot. You've seen lots of articles about discount stores, small box discount stores, also known as dollar stores. And they carry primarily some national brands, some off brands and sections, and they keep costs low by renting in inexpensive parts of town and keeping their stores staffed really thin. While dollar stores fill a need in cash-strapped communities, there is growing evidence that suggests that these stores are not merely a byproduct of economic distress, they are actually associated with it and can cause it. Small box discount stores have grown considerably, and they spread rapidly. Here's a map if you look at the distribution in the state of Maryland. So what we did, and then also I think you all who are in, this is also impact of rural areas. I first became aware of this when I visited my great-grandmother's small town that growing up we'd visited, had about 900 people. They had a regular vibrant downtown, et cetera. And I came back there about 5 years ago and there was $1 store, everything else was closed, and then one grocery store that was really struggling. So this, as you can see, it's spread over and it's overlapped with income. The concentration of the stores throughout the state, they're saturating it. Next. Again, they offer things presumably to help people. They are often, in terms of defining them, they are generally smaller than 10,000 square feet, so they're different than big box stores. However, they are subject to very little or no planning review, and there's no permitting hurdles. So the state of Maryland can authorize, I just wanted to establish this because often we'll say, well, what do we got to do with local zoning? Well, we do it all the time. The state may authorize local limits on the use of commercial properties in Baltimore City. There's a very specific code around Baltimore City. And here, there's also a stated policy of the state that will use land use that requires comprehensive regulation, and also really key is that to achieve our public purposes and our goals around the regulatory scheme, this is our state saying this, that we recognize that local government action will limit free business enterprise and competition by owners and users of property through planning and zoning. So we do, when we require comprehensive zoning, we authorize local governments to engage in zoning, we do have this expectation. Next. We also, the broader expectation is that they can do things like use zoning to abide by the plan. So everybody has a plan, and every jurisdiction submits a plan, and they're supposed to abide by that plan. And that the plan you'll see here, and this is in our Maryland code, is to promote health, public safety, and general welfare. There's some other things, but that is what our code is supposed to do. Also, the code can protect the character of a district or a zone, and it has to, here's another thing that I don't think is why we are specifically interested in regulating this, is that we can conserve the value of buildings and other structures. So again, we have some broad instructions there about how locals should use zoning. Next. And then finally, we are authorized, again, under the zoning to to regulate the location and use of buildings. Next slide. So I'll provide this, what is a discount store? It's between 5,000 and 12,000 square feet is defined in the bill. The types of food that it provides, that on average, the price of what's being sold is less than $5, so it won't get involved with other businesses. They typically operate in shopping malls and strip malls. You know all of that. So next slide. Now, what is not a discount store, and that is defined in the legislation, it's not a grocery store, it's not a pharmacy, so it's not CVS, it's not your gasoline station or electric charging site, and it's not your personal hygiene project, so don't worry, we're not affecting your hair store, like, Sally's and all that. We're not trying to make Sally's a conditional use, and also a thrift store, so it's not there. Next. Next slide. So what jurisdictions have done across the country around this is, and our intent, we're not banning small box discount stores. We're not saying that they can't happen, but we are establishing or requiring Baltimore City to establish a dispersal regulation that says there's going to be a certain distance between them. We also are instructing Baltimore City to make small box discount stores be a conditional use. And that conditional use is dependent upon the existing retail in the area, existing grocery stores, and the potential development of grocery stores and other healthy food options. So much and why. So much of the data, we've got lots of data about the community impact, that it is disproportionately contributes to food insecurity in urban and rural areas. So there'll be a local grocery store, there'll be a little hardware store, whether it's in downtown Baltimore City or, and come to small downtown Cumberland or any of the, and then that dollar store pops in there, pulls off 20% off the hardware store, pulls off a little 30% off of this, pulls off that, and next thing you know, it's the only thing left in town. The existing businesses go away. So it actually chokes small businesses and even keeps some larger supermarkets from coming in. So it amounts to what we call sort of supermarket redlining. And then just a little more. And so the sales, if an independent grocer or business has a 20 or 30% drop in their sales, they are out. That is it. Okay. And additionally, let's go to the next because there's a lot going on. We're saying that there should be a community permit, a contingency where the community agreement and the community association is a part of this agreement. So many times our communities are asked to be a part of the planning process. We're asked for their decisions, but they have no ability to actually shape anything. So we are requiring that as well. Next. And that they have to execute a community agreement if it's approved, because we're not banning. It's to say, hey, we want a dollar store, it fits, it's not going to negatively impact anybody, we've got our grocery store. So say, yes, do it, but because they do engage, the store can come in one way and then change over time, we want to make sure that there's an agreement. Next. I'll keep going with that. We know it's important. Oh, and back up. So one of the other things that's really key that you should understand about small box discount stores as part of their business model is to underpay workers, and they are cited as crime spots, not just in cities, but in rural areas, because they usually have just like one person working or two persons working. So across the country, they're known for underpaying the workers, having not a lot of people staffing, and so they are crime hotspots. We'll show you lots of data, share that with you. All over the country, this is an issue, which is why we do believe communities should be made aware if they come in. Next. This is Baltimore City. So if you look in Baltimore City, you can see see the number of dollar stores. And I'm just going to draw your attention in particular. So my district is in the middle there. So you see it's all the lower income areas, which is where the dollar stores are. You know, that makes sense, okay? But you can see that they're concentrated, like one after another, right next to each other. Now, this one in the middle is actually my district. Go to the next plan, we'll do you. So in my district, which is also what brings me to, it's along a place called York Road, so it goes from the county line, say, all the way down to Greenmount Avenue. Within 0.5 miles of each other, there's a Dollar General, a Family Dollar, and then a Dollar Tree. Okay. Now, the community plans for this area, and when something becomes vacant, was completely ignored. The communities had been fighting and putting in comprehensive plans and trying to recruit things, and their desire to have something else put in was completely ignored. So they had no idea that these Dollar Generals were coming in there, and they're so close. Next, just a half a mile down, the next slide, sorry. There's all kinds of ways that Baltimore City can. So in the bill, we don't tell them exactly how to write the code. There are a number of different options. You can see all over the country, different places, Birmingham, Florida, Georgia, Stockton, small towns, large towns have done different things. They've created healthy food districts. They've created dispersals. Some have actually banned them. And so they've done a lot of things to bring it in. I spoke with a councilwoman from Tulsa, Oklahoma, and she was one of the first ones to fight back on these dollar stores. And because of that struggle, she was able to slow down the increase of these dollar stores and force the city to do a better job at recruiting an actual grocery store. So now it's a great story. They have an actual grocery store. Next slide. The article would take effect June 1, 2022. The city would implement the provisions, and then there would be community agreements in a certain amount of time. Next. And then that's it. Again, this is we would be, yes, so this is definitely an opportunity for us to use the state zoning to support our local communities in really trying to get their locals to adhere to their planning process. I have with me Diana Emerson, who is with Waverly Main Street, and she'll just describe more about the issue, this specific issue. Thank you.
Sure. Yes. Thank you. Thanks for having me. As she mentioned, I'm the executive director for Waverly Main Street. I'm also a member of the ABLE community. It's really crucial to maintain the integrity and the character of our neighborhoods and business districts. Our area, as well as many other areas in Baltimore City, have strong business corridors with successful small businesses and entrepreneurs. Small box retailers rob our communities of our historic character while displacing existing businesses. They encourage burned out workers and low wages. They continue to hurt our businesses who are ingrained in our neighborhoods, who are working hard to be good partners, and they already contribute to the success and growth of our communities. Small box retailers quickly acquire multiple properties in small distance radiuses with no say from the community, and they have no recognition on the impact that they make to our communities, and nor do they care. They clutter our neighborhoods and make promises that they never hold up to, and they are never accountable to making any necessary changes. They make it even more difficult for our small businesses to compete, especially those who are owned by women and minority businesses. I would hope that you would support the senator's bill, which would really help our local businesses thrive and continue to make our community strong.
For your testimony and for your brevity, frankly. I am looking, I don't see, there we go, Senator Riley, and then I have a question.
Thank you very much, Madam Chair. So there's a local bill, going to submit a letter, so we're going to support it. My question is, a store comes in and then they change their model. Can you pull their ticket?
If it's, again, that'd have to be specified in the legislation, in the regulation. But if they have a lease for a particular store, I would assume that the use is associated with that particular property, that lease.
Sure, but-
Let me better
but-
understand your question.
But zoning doesn't necessarily allow you to pick and choose the company who's
Oh,
doing
right,
it.
yeah.
So dollar store is a generic definition, not a specific company definition.
Right, it's a land use. So what they'd be doing, so that's what's different about this. We're not doing a license. We're not saying a type of business. It's the use, it's the land use. So if one wants to use that property as a small box discount store, it would be a conditional use. There are probably in somewhere in Anne Arundel County, they've done it for big box. They don't allow large, they don't allow Home Depot to come in. They don't allow some of the larger chains to come in. So this is very similar to that. It's just that it's a small box discount store as defined in the law, in the code. That use is a conditional use, and so it has to go through a different process. It's not banned, it has to go through a different process, like a liquor license.
Thank you very much.
Thank you. Okay.
Senator Washington, this is a really interesting bill to me.
Yeah.
And I do want to take a small bit of issue with economic, socioeconomic levels, because these are in these dollar store, Five Below, Dollar General, Dollar Tree. I know all those logos, and they are in my district. They are in Rockville. They're in nice areas. They're in Gaithersburg. They are in the Kentlands, which is a fancy neighborhood. They're in like a lot of places. And I never really reflected. I mean, there's one that is across from Wegmans or Harris Teeter, or one of those fancy stores that I can't afford to shop at. So,
Right.
so it's interesting. So I have three questions, briefly. I see that you have a number of your Baltimore City colleagues as co-sponsors.
Yes.
Has the delegation voted on it yet, and will
We-
there be a delegation letter?
So there will be a delegation letter. I wanted to alert you that we are in dialogue. We will be making some amendments with the city, because the city sent a letter of information.
That was gonna be my
Yeah, and
next
I've been in
question.
dialogue with the city about this. And so it's not inconsistent, as you saw with what they've done before. And we just want to make sure that all the i's are dotted
Okay.
and the t's are crossed.
So I was going to ask about the mayor's letter, but you just referenced that.
Yep.
If you could just speak to the prospective versus retrospective nature of this, that would be helpful. Thank you.
So because it's a conditional use, they're prospectively, so we are not outlawing any existing dollar stores. However, if there is, as demonstrated from our police will tell you, national data will tell you that there are some real negative impacts associated with the existing stores, that we want to bring them up, give them an opportunity to become good neighbors. And so we are requiring that they also need to engage into a community agreement, a good neighbor agreement with the existing ones. But on your point about certainly dollar stores are located everywhere. It's the concentration of them, which is what is a very specific strategy. And the fact that it goes into communities, and increasingly they're going into not just the poorest areas where they claim there's no options. They are going in areas where, there's maybe a small sort of local economy going in and pulling off from these existing businesses. And they don't hire more people because their model is to just hire very few people. So they operate differently, and we know this, they operate differently in low-income rural communities than they do in the suburbs right outside of DC. It's just the data shows it.
Thank you for the PowerPoint. Thank you for the education you really offered us today. Thank you,
Great.
Senator Washington.
Thank
you,
you.
Mr. Chair.
Thank you.
That completes the hearing on 869. Senator Hester, why don't we, are you ready? Senator Jackson, who has the cyber, he wants to go last. So I don't know if there's any relationship to the bills, other than the general title. No, well, let's proceed with yours. You have 3. I don't know if there's any logical order you'd like to proceed in, or whether people are going to be testifying on 2 at once. Let's just be efficient in how we do this, that's all.
Yes, thank you, Mr. Chair. I spoke with committee counsel. There was a bit of confusion with the cross files, so I'm only going to be presenting on 2 bills today. The 2 were essentially the same. House, shoot, give me just a second.
I believe 780 and 812 are the ones that are going to be combined. Do I have that right?
That is correct. And so I'll be presenting on those together. Or the bill as amended is exactly the same. People have signed up for both.
Okay. Let's start with 754, and then we'll have, after you explain how you're going to proceed with those 2 bills, we'll have proponents on both bills come up, and then we'll have the opponents. But we're starting with 754, however. Are we right? The coordination?
No, actually, it would make much more sense to start with the other one, which is.
The other one or
Which
other
is
2?
812.
Okay, let me get this right. Which are the 2 that are expected to be combined?
Give me 2 seconds. It is 780 will be withdrawn, and 812 will move ahead. They're essentially the same bill.
And you'd like to start with those 2 before 754?
It will make more sense that way.
Okay. So we're taking up 812, and the people,
Can you pass these out?
Ben Yellen and Sam Bell will be joining the good senator. Then we'll follow with the other people on it. John Fiastro, Tasha Cornish, Matt Dudzik, Dominic Butchko. Then we'll take questions. So if you were here just on 870, if you were here on 780, you should we'll switch you. If I don't call you on 812, we'll give you an opportunity to talk to 812. And I assume when the senator explains the bill, she'll talk about what from 780 is being added into 812. Is that?
That is it. That is correct.
Okay.
And I do have a PowerPoint. It's loading. Okay, well, I'll,
Staff here or not?
my staff is right there. I don't know what the way to do. I guess you just do it. Okay, so while this is loading, I just have a few things to say before we dive into the PowerPoint. Thank you, Mr. Chair, Vice Chair, and members of the committee. For the record, Senator Katie Fry-Hester. And I'm immensely thankful to this committee in particular for its commitment for several years to passing forward-leading legislation on cybersecurity issues. Senate Bill 812, which I'm discussing now, codifies roughly 20 recommendations from the Maryland Cybersecurity Council's final report on state and local government cybersecurity capacity. As this committee heard during our January 27th briefing, during the 2021 interim, the Maryland Cybersecurity Council Subcommittee studied the threats posed to cybercrime and state and local governments. The subcommittee included the Maryland Department of Information Technology, who was just here, the Maryland Department of Emergency Management, the University of Maryland Center for Health and Homeland Security, and the Maryland Association of Counties, and the Maryland Municipal League. I've uploaded a copy of this report within your testimony. You also have one in the folder. As you heard earlier also, Maryland has faced significant challenges as a result of cyber attacks at the state and local level. From our state agencies to our school systems and municipal agencies, the need has never been greater to improve our state's capacity to implement and enforce IT and cybersecurity policy. In addition, we're at a critical point in history. And last week, the Department of Homeland Security sent a warning to private sector leaders. And I quote, "While there are currently no specific threats to the U.S. homeland, we are mindful of the potential for the Russian government to escalate its actions. But we cannot see or deal with these threats alone. As a matter of national and economic security, we need your collaboration, both in taking the necessary steps to protect yourselves, and second, in working with us to understand and mitigate the threats." This legislation addresses the decisions that must be made about threats for our public sector, including who should be responsible for making them, how those decisions should be informed, and most importantly, how they should be implemented and evaluated. The legislation achieves these goals with six main points. It codifies the roles of the State Chief Information Security Officer and the Maryland Cybersecurity Council. It centralizes IT and cybersecurity functions and funding under the Department of Information Technology. It establishes an advisory group to develop and oversee the implementation of a cybersecurity plan for the state. It requires each agency to complete annual risk assessments and certify compliance with DO IT. It appropriates a consistent budget for the Department of IT as opposed to the current chargeback model. And it streamlined the process for procurement for cybersecurity and IT contracts with increased security requirements for contractors who will have access to the state databases. So that, my friends, is the big picture. What I would like now to do is, in your folder, you'll find a reprint of Senate Bill 812. My PowerPoint will run you through briefly how those goals align with the current bill as amended. Go to the next slide. Okay, so briefly, this is just an introductory slide. It reminds you of the 6 themes to reduce risk that you heard about earlier in January from the Maryland Cybersecurity Council that this bill aims to address. Next slide, please. Okay, so when you're looking at the reprint on pages 6 through 8, this is the section that codifies the Office of Security's management duty to collaborate with the Department of Emergency Management. This is roughly what Senate Bill 69, which we passed unanimously last year, did. It also enables them to conduct regional exercises with the National Guard and establish regional assistance groups to deliver or coordinate support services. In the report that you have, this aligns with local government recommendation number 1, and it refers to the relationship that we hashed out with the guidance of Senator Kagan, Senator Mary Washington, Senator Simon Eyre, and Senator Ed Riley during many long hours, and we came up with this relationship which both the Secretary of MDEM and the Secretary of Department of IT agreed on, and that's on pages 54 through 55 in your packet, in the report. Next slide, please. So then roughly on pages 9 through 13, this is very, very similar to the bill you heard earlier from the administration. This codifies the position and duties of the Chief Information Security Officer to direct, coordinate, implement policy, to establish information security standards, to manage staff IT training, to complete annual assessments of state cybersecurity capacity, and to develop a statewide digital identity standard. It also establishes 2 new supporting positions, the Director of State Cybersecurity and the Director of Local Cybersecurity, so that the office can support both. In this section, this bill is addressing 2 recommendations from the report. Number 1, to codify the CISO position, and number 2, that the governor appoints the state CISO. There are sponsor amendments that eliminate something that was drafted incorrectly. We eliminate the duplicative reporting and the survey requirements because they weren't both supposed to be in there. And we clarify that the state CISO has authority over insufficiently secure IT systems. Next page, please. So on the pages 13 through 16, you heard earlier the governor's office and the state CISO talk about the Maryland, I can't remember what this is, the Cybersecurity Coordinating Council, which I would love to refer to as MCCC. So it codifies the MCCC, and it adds 3 members, which include a member of the judicial system and 2 members, one from the House and one from the Senate. The duties of the MCCC include advising the state CISO regarding cybersecurity strategy, prioritizing risks across the executive branch, and consulting with outside experts. This refers to recommendations 9, 10, and 11 in the MCC report. And it also clarifies that the MCC meetings may, not shall, be closed to the public in cases of sensitive information. Next slide, please. The next, this slide talks about pages 16 through 22, which address state IT and cybersecurity budget. It adds to the duties of the Secretary of the Department of Information Technology to provide and coordinate procurement for state and local governments. This is incredibly important because it will help our local governments invest more efficiently with the state and to buy and procure contracts for services and products related to cybersecurity and IT. It also allows the Secretary of IT to develop and maintain a statewide cybersecurity master plan to centralize cybersecurity management and serve as the basis for budget allocation. Having a standalone state plan for cybersecurity is a prerequisite for some of the federal money in the infrastructure plan coming down from the federal government. It changes our system from a budget to a budget appropriation, from a chargeback model. And it requires the governor to submit an annual report with specific cybersecurity IT spending metrics for public accountability. You can see that this section of the bill addresses recommendations 17, 18, 19, and 20, and there are no amendments to this section, at least yet. Pages 22 through 29 are roughly just existing law that has been reprinted. And so if you go to pages 30 through 31, in this section we're talking about procurement. It adds duties for the Department of Information to address preparedness and response plans for local jurisdictions, to coordinate procurement of managed cybersecurity services for local jurisdictions, which I mentioned earlier, and to develop and require basic cybersecurity requirements consistent with NIST standards for procurement contracts. This is in line with recommendations 6, 7, and 15 from the report. There are no amendments to the section at this time. Lastly, on pages 31 through 35, we're talking about compliance. This part of the bill requires each unit of state government, including the legislature, the judiciary, and the University System of Maryland, to certify compliance with minimum standards. I believe the report has been taken out, even though it says no sponsor amendments. There will be an amendment to take that reporting out. This PowerPoint slide is not accurate because it's different for the state unit of governments that are not the legislature, the judiciary, and the System of Maryland. So I'll clarify that later. But basically, for all state executive branch agencies, they do have to report back to do it. But the legislature, the judiciary do not. They just have to certify that they're meeting the state minimum requirements. And it also clarifies that each unit of county government, which includes our school systems and our health departments, it clarifies how they report their cybersecurity incidents. And in terms of recommendations, this aligns with number 8 and number 9 of the MCC report, and there will be sponsor amendments to this section. So colleagues, it is a big bill. I went through it as fast as I could to save you time. I am happy to walk through it more slowly offline with anybody who wants a deeper dive. I have 2 more slides before I turn it over to my panel. Next slide. Okay, so there is unfavorable testimony, and I just actually want to thank DO-IT, the Department of Information Technology. They did not submit a letter, any kind of letter yet, because the bill, as it was originally drafted, had numerous mistakes in it. We've been working hand in hand, and I think that they're available to answer questions, not now, but I think that this reflects the intent of the work group that we had this summer. So as amended, I just want to clarify what SB 812 does not do. It does not divert resources away from cybersecurity. When the administration appropriates the budget, the total investment in cybersecurity will increase, and agencies will be able to focus on their core mission first with support on IT. It does not transfer or disband employees physically to the Department of IT. All employees will stay where they are. It's very important that their valuable and specialized knowledge remains within their respective locations. Only their reporting and the budgetary lines will shift to the Department of Information Technology. SB 812 does not increase the current bottleneck and delays while working with the Department of DeWitt. The department is currently understaffed and underfunded. We are calling for an increase to both. It will also enable efficiency in procurement and efficiency in communication and increased funding. And finally, it does not conflate the executive and judicial powers. I kind of messed up that slide, but basically, these branches will simply have to certify their compliance with minimum state standards. We've been working with the Department of Information Technology on a sponsor amendment that will task the Maryland CCC to draft and implement a collaboration transition plan to accomplish the centralization. So basically, we will be working with, this is the group that is chaired by the state CISO. He'll be working with the lead information technology folks from each of the agencies to figure out how this transition best happens over perhaps the next year. But it's important that we do it now at this point in time before the next administration comes in, because we really want whoever is in the future roles of the secretary for each of the agencies to understand that they will be able to focus importantly on the mission of their agency, and they'll be able to work hand in hand with the Secretary of the Department of Information Technology and the state CISO to make sure that our state's posture is as secure as it can be. I have one final slide. For those of us who are on the Joint Committee on Audit, we've seen these audit findings where there are numerous examples of vulnerable, personally identifiable information. And I've just pulled some of these from the audit reports. So when you read the testimony from the agencies who are asking to be excluded, you can see that in various fiscal years, they've had numerous PII control issues amounting to millions of unsecured, personally identifiable information. We have more vulnerable records than we do people in the state of Maryland, and that's only across these 4 agencies. So with that, I would like to ask for your favorable report on SB 812. Happy to answer any questions now or later, but I do have 2 wonderful experts here to offer their perspective as well. Thank you, Mr. Chair.
Thank you, Mr. Chairman and Vice Chair Kagan. For this bill, I'm going to speak on behalf of Dr. Gregory Von Lehman, who was not able to be here today. He submitted written testimony, and I'm going to summarize his testimony. He was an integral member of the ad hoc committee of the Maryland Cybersecurity Council and drafted the section on governance. There are several reasons why we urge a favorable report on SB 812. First, the consolidation of responsibility for cybersecurity and IT that this bill proposes would address challenges that DeWitt faces in providing cybersecurity for the executive branch. These challenges include a lack of visibility into systems and applications used by departments, compliance with the state security manual, their cybersecurity budget, staffing, and security priorities, among other things. What cannot be seen cannot be secured. Unifying responsibility for cybersecurity in DeWitt would reduce these challenges. Second, the consolidation of cybersecurity and IT responsibilities in DeWitt would enable the state to reap not only greater security, but to see more clearly where economies of scale and lower costs for IT and security applications, systems, and services can be attained by implementing common systems across executive branch departments. Third, and perhaps most importantly, the consolidation proposed in this bill would allow departments and agencies to focus on why they're there in the first place, their business purpose, their service mission, rather than requiring them to split management and staff time and attention on maintaining and securing their IT infrastructure. And finally, in implementing this consolidated model, DeWitt would have several advantages. It has an extensive amount of survey data that was collected as part of this ad hoc study. It will have an enhanced governance group, the Maryland Cyber Coordinating Council, MCCC, a representative body of executive branch department heads to provide advice and counsel. And it has the expertise and the relevant experience from other states that were interviewed as part of the cybersecurity study, including North Dakota and Vermont, both of which have instituted these consolidated models. So to sum up, I urge the committee to adopt a favorable report with the amendments suggested by the sponsor, and thank you for your attention.
Thank you, Mr. Chairman, Vice Chair Kagan, and the committee for allowing me to testify on behalf of Senate Bill 812. My name is Sam Bell, and I'm the Chief Information Security Officer at Edwards Performance Solution, a woman-owned small business project and program management firm and cybersecurity consultancy with headquarters in Columbia, Maryland. The current funding and management structure for information technology systems within the state of Maryland does not allow us to protect our citizens' information to the greatest degree possible. The current patchwork of accountability, network systems, and decentralized information technology management does not allow the state of Maryland to effectively identify, protect, detect, respond, and recover to information security incidents. Centralization of technology management allows the state to have a complete picture of the information assets used to support the work of the state. These assets include not only servers, laptops, storage devices, but also extend to the network devices, network cables and fiber, and connections to service and telecom providers. Having a complete picture of the enterprise is the first step to being able to protect it. And make no mistake, Maryland is a very big enterprise indeed. There are many connections to federal and local systems, numerous agencies, and even more systems to protect. Without a centralized view and management of these assets and connections, it's impossible to protect the state's information systems and its citizens' data. Protecting the state's information systems require coordination and consistency on a number of fronts. First of all, data exchanges and agencies must be understood that good traffic can be identified and bad traffic can be considered suspect. Due to the highly interconnected nature of the state's information systems, incident response plans need to be coordinated at the state level and across the entire environment. So, as a result, I would like to ask that the committee issue a favorable finding for SB 812. Thank you.
I think because there are a number of people testifying, and these people are the first line of defense or offense, I think we are going to entertain questions for this group, and then we'll take the other, Ms. Cornish, Mr. Fiastro, Mr. Dudzik, Mr. Butchko. Unless you want me to take them all. Senator, it's your call.
I mean, I think that the sponsor panel can probably answer the most technical questions, but I really appreciate everybody who signed up.
Okay. They're not mutually exclusive.
Right.
So we'll take some questions for this body. Let me start off with one. And I think I followed as much as I could, Senator, the PowerPoint. A number of organizations wanted to opt out. And it may be, yet you put a slide in there that said it's really only for reporting and financing. But I guess the question, and again, I haven't read all the testimony, had to do with, I'm going to use a loose term of control or coordination. PSC, State Department of Education, Judiciary had variations on that theme. So I'm trying to understand if the bill keeps them in because it's got to be consolidated and centralized or we're going to have problems, or in fact, you're giving them the flexibility and it really is only financing. If we can, you know where the opposition's coming on
Yes,
this.
I do.
And I haven't even seen anything USM, which usually is the first one in line to say, take us out.
I believe they're here today.
Okay, I don't know if they were signed up on this, I don't know. But anyway, there are a number of other, so are they in, are they out, to what extent, or are they simply wrong? So,
Could I take a first crack at the?
no, I think this is one of the fundamental questions, and I think we might as well put it on the table.
So in the current bill, they are in. I think that there's confusion in the opposition's testimony. We are not taking away their systems, and we are not taking away their people. The systems stay where they are, and the people stay where they are. What's different is that who's making the decision on how much to spend on cybersecurity and what the people do. Currently, let's take the Department of Commerce, for example, or Department of X, right? The Secretary of Department X can say, well, I've got all these mission-critical projects. I don't really want to spend an extra 10% on cybersecurity because I want to do X grant program. That is the decision of the Secretary of Department X. This would take that decision-making and move it from, that secretary to the state CISO and the Secretary of Information Technology. And so they would then be saying how much you spend in collaboration. But the person who's run point on information technology and cybersecurity for that agency stays where they are. They still want to be, they know the business processes better than anybody else in that department. They will stay there. It's just that they will have now a direct reporting line to the Secretary of the Department of Information Technology. This is a general trend across the United States. We heard this interim from the state CISO from Vermont and the state CISO from North Dakota, when they've both done this successfully, and both have saved money. Vermont saved $15 million the first year. North Dakota saved $450 million from the efficiency in procurement contracts.
And again, much more than I do on this, and I'm just trying to skim it. Like on the State Department of Education, they talk about the files of 900,000 students and keeping.
They do get to keep those. They get to keep.
Right. No, I don't think they're handling it off to do it. In terms of the security and the oversight and the management, I think, and again, I'm just trying to understand the implications. I'm not locking in on support or opposition. I just want to understand it because it's a big bill and it's some changes. As I read there, and PSC to some degree, it's a little different. It's about oversight, management, and maybe security. I don't know. And I don't know whether they should be keeping themselves or, in fact, they should be shifting that to do it. So besides the spending, I heard that answer. Let's talk about the macro picture of security.
Well, I think
I might not be asking the right question or asking it correctly, but.
No, I think you're spot on, sir, in the sense that Maryland is a very large enterprise, and those agencies are significant users of Maryland systems, but also are folks that are on the front line and are potentially at the point of vulnerabilities being introduced into the environment. We have to look at the entire state holistically, because if we try to just protect a series of individual boxes without putting a nice hard shell around it and then monitoring what's going on from a data perspective between systems and whatnot to understand if data is leaking out or not leaking out or being protected appropriately, that is the type of thing that is very difficult to do in a point-by-point solution. You have to address that from an enterprise perspective. You have to address that auditing systematically across the entire environment. And you have to address incident response and how you're going to respond to a cyber incident across the entire state, because threat actors and malware does not know the boundaries of agencies, departments, or local government. It will go wherever, and if we don't have that management centralized, we won't necessarily be able to see where the problem may lie or that we're even under attack.
Vice Chair.
Thank you. Senator Hester, thank you for your years of work on these important issues. Truly, you have just been so nose to the grindstone and stuff, and trying to explain all of these complex issues to those of us who are not like a microscopically aware as you are. But I have a couple of questions, because as you know, I've worked on these issues related to 911 and emergency response. So I have two totally random questions, two different questions. One, on page 8, lines 5 and 6. It talks about developing cyber scorecards and reports on regional readiness. And it seems to me, so I'm all about transparency, and I think government should be accessible, but cybersecurity seems to be the one area that we don't want to be so transparent, because that doesn't serve us well. So could you speak to the concept of transparency and accessibility versus confidentiality, and how you envision these report cards sort of being effective and helpful? So that's one question. And then sort of in a separate box, there's a lot that is being put into do at the Department of Information Technology, and I like Secretary Leahy and all that. Let's envision X years down the road. Some future governor that we cannot currently envision, hire someone who's maybe a buddy and maybe who's not that good. And how would this work? If this were law, what sort of accountability and sort of insurance policy would we have to make sure that DoIT wouldn't sort of mess everything up 20 years down the road with an incompetent secretary of the Department of Information Technology? And you can take either one in any order. Thank you.
Thank you, Madam Vice Chair. Taking the second question first, I've been in a conversation this week with the National Conference of State Legislatures. And they recently sent us the research they had done on the qualifications for the state CISOs and the state secretaries. And Michigan, North Carolina, Florida, Virginia, California, and Virginia and several others have qualifications. So this is one of the amendments that we're working on, is to make sure we have good qualifications for both of those positions, possibly with a confirmation by the Senate.
Before you go on to the other question, then, if I could just proffer the challenge that we have with recruiting and retaining talented people in the technology field, because we all know that we can't pay them enough, and the private sector can compete and snag them away. So not only would we want standards and getting the best people, but how do we find them, lure them here, and then keep them?
That is a really good question. And over the past couple years, for all of our state employees that are in the information technology, we've been working with the Department of Budget Management and the Department of Information Technology to look at raising the rates that we pay, and also look at the qualifications that these people, and moving away from a degrees-based competency towards a skills-based competency in line with the NICE framework. So very good questions. Your first question was about the balance between transparency and security. And so, as you might have noticed from our amendment to the MCCC, we were allowing this group to close some of their meetings where security issues are being discussed. In terms of the cyber scorecards and reports on regional readiness, the page you returned to was the page 8. Yeah. The intent here was that just like the Maryland Department of Emergency Management works with the Opioid Operations Command Center on regional basis to look at opioids, they would do the same thing with cybersecurity. Now, the intent is not to publish these, but so that in a regional way, we have groups like knowing where they have to go and making steps to get there. But I do not intend for us to publish these and make them publicly available.
Report card, I mean, it's an election year. I think of, XYZ interest group publishing our report cards for how we voted on issues of interest to them.
Yeah.
So that's what
I think we should tighten this up.
I think that could be a good idea.
Thank you very much.
Absolutely. Thank you, Senator. Thank you, Mr. Chair. Oh. Washington has questions.
Thank you, and thank you for your relentlessness on this topic. And so it's hard, because here you are, you're saying, look, we have all our houses and your windows are open, your door is open, somebody left the key in the back door, or if it's your own house, but then you also, your house is connected to somebody else's house whose window is open, well, maybe you close your doors and you're okay, but because you're connected. And so, I could continue on that. So I get it, but it's really hard, I think, sometimes for folks to get the sense of urgency. So it is a dangerous situation. And so I think the balance, and again, I appreciate your relentlessness in getting us to understand that increasingly our exposure to cyber attacks are just going to increase, and the nature of war, as we're already seeing, it's not for us, may not be so much as, the way it was physically in a ground war, but that they can easily just go in and shut down our operations. And so I guess I want to ask about that balance, or, this notion of this is my house, this is my department, I should define how I take care of my house, versus establishing the interconnectedness, of a network system where there really isn't such a thing as private ownership. I mean, to me, that seems to be what's key, and not, am I getting it? That's how I
Senator
start to
Washington, you're
understand.
getting it exactly. That is so right. And I think it's a shift that we're seeing kind of across consumers of technology across the board. For the longest time, technology, I think, has been evaluated like we used to price adding machines and typewriters. And, it's a matter of, well, how long will the system last and how many years will I get out of it? Not some of these other criteria that are very, very critical to keep our information systems secure. And that's why this bill, coming back to the scorecard, calls for the use of the NIST cybersecurity framework to assess each of the systems in the agencies in a standard fashion to make sure that everybody is looking at their world through that same lens and that same set of criteria. I worked in application development prior to coming into system security, and what I saw again and again and again was feature functionality always trumped system security, and it used to make me crazy. There's what I'll call a four-letter word, non-functional requirements. Folks will call them non-functional requirements, but really what that really was, those were the security, availability, and confidentiality requirements of the system. And those have to be taken into account. And this is a shift that I think IT organizations are going through across the world. I don't think this is just limited to Maryland State. I think it's something that we're seeing across the board, and this shift from looking at IT expenditure as OpEx and instead treating it more as a strategic enabler of doing the state's business or an organization's business. So you're absolutely right, and that's why this bill is so important, to get us to start to think more holistically and understand that what's going on in my backyard could very well affect you and your system and your environment.
And then I guess I have a question. It's like, well, so in our, who's in charge of it? And is that the question? I mean, that seems to be your point.
That's
It's like,
the question.
There's no one person in charge. So we have someone who's in charge of agriculture. We have someone that's in charge of the school systems, but we don't have someone that's in charge of IT. And also, for each of the departments I wanted to ask about the qualifications. It could just be the person who got the first computer and now they are the IT specialist in the department. I mean, I know that it's at that level. So who, are you saying who should be
That is
charge
the
of
fundamental
that?
question, in the bill. And just to your point about the open network, we currently are all connected on Network Maryland. So we're already all connected. The issue is we have a federated governance system, which means each agency does their own thing.
Right.
With the exception of a handful of agencies that are already working with Do It. So Do It already does, I don't know, if it's like 20, 30% of the agencies, and the other, 60, 70% are on their own. But in each of those agencies, it's the Chief Information Officer for Department X who reports to the Secretary of Department X who's making all the decisions.
Right.
And so we're trying to leave the people where they are, leave the systems where they are, but make those Chief Information Officers for each department report to the State CISO and State Secretary for Information Technology who will meet these qualifications.
Yeah.
And I think that will raise the overall caliber. I mean, not, our people are doing a great job. They just don't have the money. Like, right now, the federal government recommends 15% of your total IT spend be on cybersecurity. The average state spend is 2 to 3% of IT budgets. And we have no clue in the state of Maryland how much we're spending because DO-IT doesn't have visibility into the budgets or the procurements.
And so we make sure that we have the latest version of Adobe or the latest version of whatever, rather than paying for security. And then I want to understand the model of, that's why when I was thinking about it, it's that idea that, I could be living in a house with other people or whatever, I protect my door, I do, et cetera, but everybody else isn't abiding by the same rules. And we certainly learned that with COVID, right? We have this, that's why we had to have certain mandatory things to protect everybody. So, again, the light bulb went on in my head. Maybe it went out too. But thank you. I finally get it. So thanks for really pushing. Thank you.
Further questions for this panel? Seeing none, thank you all. Let us move to Tasha Cornish, John Fiastro. If there's space, Matt Dudzik and Dominic Butchko. And then we'll take questions, then we'll go to the Public Service Commission, who opposes the bill. You may proceed in whatever order you choose.
Sure. Thank you, Mr. Chairman, Madam Vice Chair, members of the Education, Health, and Environmental Affairs Committee. For the record, my name is John Fiastro on behalf of Cybersecurity Association of Maryland. We do want to say thank you to the sponsor, as she has put a lot of work into this and really brought this to the attention of the state. And if there's ever an example of one legislator kind of taking an issue and putting it in front of everyone, and everybody says, oh yeah, that's important, this would be one of those. So we want to thank the Senator for doing that hard work and leading this effort. The bill before you actually brings a lot of that hard work to fruition and puts ink to paper, bringing up these issues and centralizing them within DO-IT, a very critical piece. And with that, I'm going to introduce Tasha Cornish, Executive Director for Cybersecurity Association of Maryland.
Thank you. Chairman Pinsky, Chairwoman Kagan, and members of this committee, thank you again for the opportunity to be here today to urge a positive result. So for the record, my name is Tasha Cornish. I'm the Executive Director of the Cybersecurity Association of Maryland. We have over 600 members in this state of cybersecurity professionals who are deeply passionate and care very much so about this issue, so I'm pleased to be here on their behalf today. Codifying the establishment of the Office of Security Management and the Maryland Cybersecurity Coordinating Council, or MCCC, as I like that, is essential, and we applaud the bill authors in including the private sector expertise here and allowing them to consult accordingly. By centralizing procurement, we know that this will boost the efficiency of the program and will promote fiscal responsibility while reducing unnecessary redundancies, as we heard the sponsor panel state. We need all agencies specifically to report certain incidents to contain the threat and prevent these future attacks. Especially in this heightened threat environment, it is imperative to exempt the council from the open meetings and allow them to meet in confidentiality for the same reason. We need to create the space for threat sharing, as other states have done, which will help us contain further attacks. So thank you for your time, and I urge a favorable vote here.
Mr. Chairman, members of the committee, thank you for having me here today. Dominic Butchko with the Maryland Association of Counties. MACO supports Senate Bill 754 and Senate Bill 812 with amendments. First, I just want to thank the work Senator Katie Fry-Hester. This has been multiple years in the making and is an awesome job. A strong partnership between state and local governments is essential for safeguarding critical infrastructure and defending against increasingly complex cyber attacks. I want to highlight for a second, earlier this week, county cyber leaders actually had to be briefed by federal officials on the risks related to the Ukrainian war and how that could spill over and impact our local governments. These bills are the first step in the right direction to strengthening our cybersecurity infrastructure. MACO advocates for the state to offer shared service agreements, 24/7 network monitoring, real-time incident response, statewide risk assessments, and a dedicated cybersecurity support fund to help your local government partners. I also want to highlight the critical need for cybersecurity insurance. It is becoming incredibly expensive and nearly impossible for local governments to get, especially in this environment. Both bills are the right step in a necessary direction for protecting our cyber systems. Cooperation, coordination, and partnership between state and local actors is the only way to keep all Marylanders safe. Accordingly, MACO asks for a favorable report with amendments on both bills. Thank you.
Thank you. Is Matt Dudzik here from the board? Matt, why don't you come up and then we'll take questions. Folks, don't leave yet. There may be a couple questions.
Thank you, Mr. Chair, Madam Vice Chair, members of the committee. Matt Dudzik with the Maryland Board of Physicians. I think it is fair to say that everyone at the Board of Physicians right now has a very deep appreciation for how important cybersecurity is. I suspect this is true for most of the other health occupation boards as well. So we appreciate the sponsors' hard work to facilitate the development of a cybersecurity master plan, and we absolutely support measures that will help to make sure that such a plan is not just developed, but also implemented and carried out by all units of state government, including the board. The sponsor and the previous witnesses did a great job of discussing why such measures are necessary, and you have a written testimony. So in the interest of brevity, I'll try not to repeat myself. While the board supports the bill's overall goals and directions, we did have some concerns about some of the uncodified language at the end. Specifically, if you're looking at Senate Bill 812, sections 4 and 5. As written, these provisions would transfer significant resources from the board to the Department of Information Technology. Our IT resources are vital to the board's ability to function effectively. We are more than happy to work with DoIT to implement any policies and best practices, including those that are brought up within this bill, and to develop reporting requirements that allow for proper oversight of these policies. I appreciate the sponsor's assurances that this will not result in the transfer of staff, but the board would like to see that language clarified. So we would support this bill, but recommend amending sections 4 and 5 to clarify that they do not apply to the health occupations boards. Thank you.
Questions? Seeing Senator Washington.
So I want to understand. So in this model, in some way, to ensure the safety of all, you have to give up some control, right? So what is it exactly that you feel like you would need control of, and that you would be unwilling to get, because we don't have one person who's in, or one entity yet who's really is the expert in making sure that all of our houses are safe. I'm going to continue to use the metaphor because it's really helping me. And so, or if we lived in the same house, and so there's somebody that has to, so it seems like you have to give something up in order to be safe, because right now you're not safe. You don't have the ability to fully, you might own your data, but you don't have the ability to fully protect it unless you give up access. Do you get it? So I'm trying to understand, because we've got to work through this, because it seems like every division has this issue. So are we truly willing to give up a secure system in order to say, we're the only ones that have access? This is not rhetorical, it really is, because it seems like it's a...
I'm sorry, and thank you for that question. And so just to clarify, the majority of the bill we are actually more than fine with. So, and the bill includes things like the annual vulnerability and risk assessments, the reporting requirements so that, our staff is reporting to DoIT and is following these procedures as they're being set forth. Those are things that we have no issue with. We're specifically referencing, I believe it's on page 35, toward the end of the page, Yeah, lines 29 through 32, for instance, that actually specifically transfers, and I should clarify, the Board of Physicians is specially funded. So these are not coming from state funds. These are coming from licensure fees paid by healthcare practitioners. And it is transferring all books and records, real and personal property, equipment, fixtures, assets, liabilities, so on and so forth, for the purpose of information technology to the department. That is a significant concern to us, and I believe Senator Kagan brought up some of those concerns when she mentioned that, certainly we may have very talented people that are going to allow us to more or less operate autonomously, but there's no protection built into this. And that's why we're asking for some language clarifying that these resources can't simply be transferred away from the board, and I assume this is likely true for other agencies or other units as well, but of course specifically for the board, without some protection for the board built in.
Okay. So can I ask them how, as look, we keep doing this bill over and over, and I really just want to understand it. How do you hear that concern, and how would you address that? As the IT people, you hear this concern. What assurances, or how would you direct us to write it or fix it so that they can feel comfortable? Does anyone have an answer for that? Because if
Senator,
we don't solve that,
I'm sure
we're not
that
gonna.
there's a member of CAMI that would love to answer that, or it's probably more technically qualified. I
All
mean,
right,
we're testifying on
can
behalf of the
someone-
association, but
All
we're
right,
not.
well, get to us, because if we don't address that fear, then we're never going to create a safe system. So there's a culture, people own their stuff, they own their data. We have to get out of that, but there's got to be some kind of, some sort of middle ground where people feel comfortable. So I just trying to understand.
Thank you.
Thank you. I mean, it may be, committee, we might have to have a special work session just on these few bills. I mean, I know. No, I was just following up that it is complicated, and I know they're still working on amendments, and we have your other local bill, the coordination, and we have Senator Jackson's bill. Just as we had a climate change, a special meeting session for that, we might have to schedule the same. It won't be till next week, but anyway, we have to consider that. We have the Public Service Commission in opposition, Mars Wu.
Thank you. Greetings, Chairman Pinsky, Vice Chair Kagan, and committee members. My name is Mars Wu, and for the past 23 years, I've been the Director of IT for the Maryland Public Service Commission. The PSC is a quasi-judicial, independent agency under the executive branch charged with regulating public utilities in Maryland. The IT division here at the PSC is composed of highly trained professionals who create customized applications and solutions that the Commission can use to be more efficient, more effective, and more responsive to Maryland ratepayers. What's more, though we are in the executive branch, we're completely self-funded, we're completely independent. Like the judiciary, we have our own attorneys separate from the Office of Attorney General, which represents the agencies that appear before us. That same need for independence is why we employ our own IT staff to not only leverage unique technologies, but also to independently carry out our mission without interference or control from the entities that are parties to our proceedings. A noteworthy example of the Commission's responsiveness occurred during the onset of the pandemic. The IT staff at the PSC, at the very outset, was able to immediately provide the Commission with the ability to continue its daily operations and to conduct its proceedings and hearings without any delay or loss of service. Ladies and gentlemen, we were one of the few, if not the very first agency to accomplish this. In fact, many public service commissions from outside the state, other states, they reached out to us to gain guidance on how to effectuate our model as we transition to the telecommuting environment. To sum up, my concern here is that the Commission's IT staff and resources, if they were transferred from the PSC to the Department of IT, that nimbleness and agility to deploy innovative and responsive solutions to our constituents would be compromised. I just respectfully ask on behalf of the Public Service Commission that we be exempted from sections 4 and 5 of Senate Bill 812. Thank you for your time.
Yeah, thank you, Mr. Chairman. And listening to your testimony was very interesting. And congratulations on your long tenure at the agency.
Thank you.
So listen to Ted, you said in the beginning that you're a judicial and executive organization, judicial branch. So I thought you could either be one, you're judicial, or what do you mean by that? You're both.
I think my statement was quasi-judicial, so the commission operates with independent authority. It operates very similar to a courthouse, where the chairman and commissioners render decisions through its proceedings and cases in its mission to regulate utilities.
Okay. So it's more like administrative law area. Is that what you're saying?
Well, I think it's, I'm trying to create the most accurate analogy, and I believe it would be a courthouse where the commissioners and the chairman are rendering orders and decisions in the attempt to regulate public utilities on behalf of the residents of Maryland.
Yeah, I understand. I'm trying to understand. So basically, you're an executive branch agency with authority to have administrative hearing officers to go through this. I know you're in IT, and someone in the audience is saying yes, so yeah, and thumbs up, so thank you for that.
Yeah, Senator, they have a very large investigative and research and policy branch. It's not simply the judge and courtroom. I mean, so in other words, I mean, they're setting rates for the utilities who come before them. And they don't just listen to this side and that side, they do their own independent work as well and hire consultants. So it's a little more multifaceted. I don't want to make it an exact corollary to because they have a panel of people who research these issues for a long time. I mean, some of these cases go on for years, and they also have staff that does a lot of data collection and a lot of other things. So it's a little more than that. Is that fair?
That's correct. I'm sorry. The topic is a bit outside of my wheelhouse, and so I did the best I could in my experience working at the commission to provide you with what I.
Well, you start rolling that wheel, so I had to ask you. So.
Well, Mr. Wu, we deal with a lot of stuff that's outside of our collective wheelhouses, and we still set policy.
Thank you.
Senator Hester, followed by Senator Washington.
Mr. Wu, thank you for being here. I was just curious, are you, Mr. Wu? Over here.
I'm sorry.
It's okay. My question is, are you aware of the specific report on utility cybersecurity that the Maryland Cybersecurity Council did over the interim under the leadership of Laura Cochran from NSA?
I'm vague on that. I'm sorry.
Okay, we would be happy to send you that report, but there were two studies that the Maryland Cybersecurity Council did, and one was, the one that I've referenced that people have on their desks. The other one looks specifically at utilities because of the potential cybersecurity issues that could happen with them. So we'd be happy to send that to you. And you may also want to know that Senate Bill 810, Cybersecurity Critical Infrastructure and Public Service Companies, will be heard in the Finance Committee on March 15th. And I would suggest that I'd be happy to work with you. We've already reached out to PSC, one of your colleagues perhaps, to work with them on that specific bill. So I just wanted to see if you knew either one of those two things. And then this, for the committee's benefit, the sections 4 and 5 of the bill that are frequently referenced, those are actually uncodified language at the end of the bill. I think that they're causing a lot of concern the way they are drafted, but if you look at the majority of what's actually going into statute, people shouldn't be, the concerns are on uncodified language, which we can easily, change, because the intent I do not think is captured accurately in sections 4 and 5. So happy to follow up with you offline. Thank you very
Sure.
much.
Thank you. And again, congratulations on your success.
Thank you.
So, so do you operate, are you in a closed, separate system, or are you part of the enterprise system? Do you, yeah.
We are a hybrid. We do utilize some services that are offered by Do It as far as Network Maryland connectivity. Because, as I mentioned, we have our own IT staff.
Yeah.
We are able to leverage that to provide our own customizations when it comes to data processing, as well as, for example, our website.
Right.
And we always had a very close relationship with Do It to make sure that we are in accordance with all of their branding protocols, as well as, most importantly, their cybersecurity policies. And
But you're not using you are using the Maryland network that everyone else is using.
correct,
So you're all on the same highway, the same.
correct.
Okay, so if you're, why, and again, this is a real question. Are you okay, or are you comfortable with that there is an identified entity whose job it is to make sure that the network that you're using is safe? Okay. And that as long as you get to be the control of your applications, which is what it sounds like, you're not, and your computers, and then you're okay with that. So that's your fear, is that somehow Do It will come in and pull your shop into its shop.
Correct.
Okay, so that is not the intent of this at all.
Okay.
It's really for us to make sure that the highway for everybody is safe, and that we have people whose job it is to make sure that it remains safe for everyone, and not have to rely, on individuals saying, yes, I'm safe, I'm doing it, but you're being provided with the support and the technology to actually make sure that everybody is abiding the same standards. Okay, great. All right, thank you.
Thank you, Mr. Wu.
Thank you.
See Mr. Stanek? Tell him we say hello.
Will do. Thank you, sir.
Okay, that takes care of 812 and 780. Yes? We're going back to Senator Hester, 754. Coordination, this is Local Cybersecurity Act. We have the senator, joined by Ben Yellen once again. Anybody else? Oh, okay. Mr. Bell? It's the same cast of characters. Okay, with that, this is a different bill, however. Local Government Cybersecurity, 754.
Thank you, Mr. Chair. For the record, Senator Katie Fry Hester, proud to represent District 9, here in support of SB 754, the Local Cybersecurity Support Act. I'd like to thank the committee for their attention to the previous bill. I think this one will be much shorter. We've done the hard work in the previous one. This one builds upon that. Once again, this committee heard during our January 27th briefing, the briefing on the work of the Maryland Cybersecurity Council, which studied the threat posed by cybercrime to local governments. There were 3 sections of the report. The first part of the report dealt with cybersecurity governance, which we've just dealt with in the first bill. The second part dealt with state IT systems, and the third dealt with local cybersecurity support. So this bill addresses the recommendations in the third part of that report. I wanted to give you a high-level overview of the 3 big things this bill does. I'm not going to walk you through the bill page by page. Much of it is duplicative with the previous bill. because when you create the State Office of State Office of Security in code, you have to recreate it in each bill. So I would say 20 pages of this you've already looked at. So what are the three things that this bill does? First, it leverages the state's resources to codify and fully fund the cyber unit within the Maryland Department of Emergency Management. This unit currently exists. It's funded by a 2-year federal grant, and it is working in collaboration with our state CISO, the Chief Information Security Officer, to support our local government's development of vulnerability and cyber prepared response plans. It also serves as a focal point for local governments to notify the state and mobilize relevant agencies if they are the victim of a cyber attack. So that's the first thing that it does. Second, it establishes a local cybersecurity support fund to provide financial assistance for cyber preparedness efforts. This could include upgrading current devices, purchasing new software, paying for cybersecurity training, but the language has also been amended to provide for increased flexibility to meet our county or municipal needs. This also ensures that we're able to reduce disparities between the larger, wealthier jurisdictions and the smaller, sometimes lower income jurisdictions. This fund is also intended to serve as a local match for the state local cybersecurity grant program that recently passed in the federal infrastructure bill. Finally, this bill codifies the forthcoming Information and Analysis Center within the Department of Information Technology and in partnership with the University of Maryland, Baltimore College's Institute for Innovative Computing to coordinate and disseminate information on threats, resources, and responses to cybersecurity incidents with our local units of government. In our digital age, it's not enough for the state to simply protect itself. Vulnerabilities at the local level pose just as much a threat to our citizens' data as those at the state level. When the Maryland Department of Health incident happened, it affected not only the State Department of Health, but our local Department of Health, as well as our boards. And the Board of Physicians who just testified, they are currently experiencing the same incident as the State Maryland Department of Health. So our local governments are eager to address these vulnerabilities, but they are very limited in funding and staff, which present the greatest obstacle. Senate Bill 754 provides these three distinct solutions to these problems by leveraging the state's resources and for these reasons, I respectfully request a favorable report on Senate Bill 754. And I'll turn it over to the panel.
Thank you again, Mr. Chairman and Vice Chairwoman Kagan. This time I am speaking on behalf of myself. My name is Ben Yellen. I'm the Program Director for Public Policy and External Affairs at the University of Maryland Center for Health and Homeland Security, and I served as Senator Hester's co-chair during the interim study from the Maryland Cybersecurity Council on state and local cybersecurity. Part of the impetus for this section of the report and for this legislation is we've seen a proliferation of cyber attacks on units of local government. Of course, the city of Baltimore suffered a ransomware attack in 2019 that cost the city about $18 million in lost revenue and in amelioration efforts. There was a cyber attack on the Baltimore County school system, and then the Kaseya cyber attack that took place in 2021 affected many of our smaller jurisdictions, including Leonardtown, Maryland. One thing we learned about in conducting this study are that there are significant vulnerabilities and preparedness gaps at the local level. Though our counties, school districts, local emergency management offices, and other units of local government are making good faith efforts to improve their cybersecurity posture, many of these agencies have not completed vulnerability assessments, do not have consequence management plans, and they simply do not have adequate staffing resources to address the current threat landscape. We heard in focus groups with county IT professionals and from representatives of our local school districts that they could use the state's resources, particularly the resources of the Maryland Department of Emergency Management, their expertise in resource coordination, and as a coalescer of preparedness materials, and of course the technical expertise of the Department of Information Technology. If passed, Senate Bill 754 would accomplish these goals. As Senator Hester mentioned, the bill would codify the existing cyber preparedness unit in the Department of Emergency Management. This unit would be tasked with supporting local governments in conducting vulnerability and risk assessments, maintaining a database of cybersecurity resources, and would assist local governments in adopting best preparedness practices as established by the state CISO. Additionally, this bill would establish the local cybersecurity support fund, and that would provide financial assistance to our units of local government to both enhance preparedness and to assist these units in obtaining federal cybersecurity resources. I want to briefly note that we have worked closely throughout this process through the study with the Maryland Association of Counties and the Maryland Municipal League in crafting these recommendations. I'm very pleased that both of representatives from those agencies are supporting this bill with amendments. Several of the amendments they suggested over on the House side, I think all of us would be very supportive, particularly removing the requirement that units of local government have to meet certain minimum security standards to obtain funds under the local cybersecurity fund. And we've worked closely with the Maryland Department of Emergency Management in order to craft some sponsor amendments to match the bill more closely to the agency's current capabilities. I just wanted to thank you for your attention to this bill and your commitment to cybersecurity, and I respectfully urge a favorable report on SB 754. Thank you.
Thank you, Mr. Chairman and committee. Again, my name's Sam Bell, Chief Information Security Officer at Edwards Performance Solution. And as we've discussed before in great length, the interrelated nature of state, local government information systems, we have to really look at them as a whole as we go to try to secure them. Many system-to-system connections, as well as common tools, even as email, that glue them together into a common enterprise, and we have to address and treat it appropriately. Given the degree and nature of funding at the local level for information technology, it's not always sufficient to fully address the security needs of local government or those state systems. And additionally, those local agencies may not have the qualified staff available to fully assess and manage their technology risk. Since systems have to be approached from an enterprise perspective, this also comes true when we start talking about incident response and coordination and communication during those incidents. The bill calls for establishment of the Information and Analysis Center to provide knowledge and information sharing regarding threats and vulnerabilities across the state and local governments. Good cybersecurity also requires regularly assessing systems for vulnerabilities and putting in place the means to remediate those vulnerabilities, as well as establishing those incident response plans. Everyone accessing state and local systems need adequate training on good cyber hygiene and how to respond to suspected incidents. The cyber preparedness unit, as outlined in the bill, will support local governments to establish these capabilities at the local level. A critical component to minimize the impact of a cyber attack is speed of response. And by making sure that local government is included and is appropriately funded and is part of the enterprise view of the state's information systems will ensure that our state and our local governments are protected. With this, I would ask for a favorable recommendation for State Bill 754. Thank you.
I'll allow any questions now to the panel who helped shape this. Seeing none, we'll go to the next panel. Thank you all for your patience and testimony.
Mr. Chair, could I just point out that in the folders, there is a redraft with sponsor amendments. As the previous bill, this one came out, in a hurry, and so there were some sponsor amendments, and I provided that in your folders. Thank you. Yes, for this bill.
Justin Fiore, Ms. Cornish, Mr. Fiastro, and Mr. Butchko. We can also accept the Me Too. I know you're all experts in cyber technology. So if you don't want to get too much in the substance, as has been said, let's try to be additive if we can.
Thank you, Mr. Chair, members of the committee. Justin Fiore here on behalf of the Maryland Municipal League in support of Senate Bill 754. I want to thank the sponsor very quickly and follow that up with the Me Too.
Mr. Chairman, Dominic Butchko from the Maryland Association of Counties. Thank you for having me. MACO is also Me Too.
Mr. Chairman.
Me Too with amendments.
Mr. Chairman, John Fiastra on behalf of Cybersecurity Association of Maryland. I guess me too. I'm going to hand it off to Ms. Cornish.
Tasha Cornish, Executive Director of the Cybersecurity Association of Maryland Incorporated. Favorable with amendments. Me too.
Yeah, I don't see you sign up with amendments. It may
Oh.
be.
I think in support of the sponsor amendments.
Exactly, in
Oh.
support of the sponsor amendments. Thank you.
That's a
Thank you.
tough call. Thank you. Questions for this panel? Seeing none? Me too. No, thank you. Okay, that completes the hearing on 754. We're down to 2. Ladies and gentlemen, I know there's an event tonight, and we have voting, and I feel I'm very sympathetic to the concern. We're just going to keep rolling as quickly as we can. That's all I can tell you. Next, I think we have Senator Jackson. With Senator Jackson, some of the same people. Hold on. Bryson Popham is the lead witness, and then we have Justin Fiore, Dominic Butchko, Mark Cather from the USM.
Afternoon, Mr. Chairman, members of the Education, Health, and Environmental Affairs Committee. For the record, Senator Michael Jackson on behalf of Senate Bill 107, state government, state and local government employees and contractors cybersecurity training. I hope you're not overburdened with cybersecurity today. I won't be before you long. Senate Bill 107 is a pretty straightforward bill that simply establishes a cybersecurity awareness and training program for state employees and contractors. Just for the record, each year before I come to the General Assembly, I complete my cybersecurity or security awareness training for my county job. So we've been doing that in Prince George's County for quite a while, and some of the other jurisdictions are doing it as well. Beginning October 1, 2023, each state and local employee would be required to complete quarterly certified cybersecurity trainings if the job duties of that employee includes accessing a state or local database. Under this bill, the Maryland Cybersecurity Coordinating Council will be tasked with creating the program consisting of periodic cybersecurity training activities. The state Chief Information Security Officer will be tasked with conducting periodic audits to ensure compliance and with working with the Maryland Cybersecurity Council in the certification of said trainings. Additionally, the State Chief Information Security Officer would also be required to approve and audit certified training courses for contractors who access state and local government computer systems and databases. Government contractors will also be required to verify the completion of said trainings before beginning work under any contract or before any contract renewal term. The rationale behind this bill is pretty direct as well. Because of the sensitive nature of the information that government employees and contractors deal with, it's absolutely imperative that we do a better job of protecting information. Maryland citizens, the 2 previous panels, or the same panel on 2 previous bills, spoke to some of those occurrences. State employees and contractors often have access to very vital information and other pieces of data. If compromised, the impacts are absolutely dire and incredibly long-lasting. So with that, Mr. Chair, I will ask the committee for a favorable report. And as with any other piece of legislation, we are willing to work with the committee to make sure that it's meeting the goal and we're protecting the information of our Marylanders. So with that, that's it. I'll hand it over.
Thank you, Mr. Chairman, members of the committee. Bryson Popham, appearing before you today on behalf of T. Rowe Price in support of Senate Bill 107 with an amendment. T. Rowe Price, as I'm sure the committee knows, is a worldwide financial services company, a major mutual fund complex. Among other things, they hold our state 529 class assets in trust. They know the need to protect the assets that they have, and they are in possession of a very robust cybersecurity system. I've spoken with Senator Jackson and with others, and most recently, Mr. Chairman, with the DO-IT representatives out in the hallway a little bit earlier about the amendment that I am offering. The amendment would very simply permit the State Chief Information Security Officer to consider a cybersecurity training program like that of T. Rowe Price and determine whether it complies with the state requirements that are required by the bill. When I testified on this bill a couple of days ago in the House, I got a question from a member about whether T. Rowe would be willing to share some of its cybersecurity training components with the state. I feel certain that I can extend that request, but it's an indication, I think, of the sophistication that my client would have. If this is not necessary, and the Do It folks may say, yes, we have the authority to do this already, you don't need the amendment, we'll happily withdraw the amendment. But we offer it now just in case it's needed. With that, Mr. Chairman, we respectfully request a favorable report on Senate Bill 107.
Thank you, Chairman Pinsky and members of the committee for the opportunity to share our thoughts on Senate Bill 107. We're asking for a favorable report from the committee with amendments. My name is Mark Cather, and I'm the interim Chief Information Security and Privacy Officer for the University System of Maryland. The USM wholeheartedly agrees that cybersecurity education and training are an essential part of securing any organization. Given the number of threats in the world, it's not possible to secure our environments without training our workforce. That said, the training and education needed by the USM workforce is different than the training and education needed for workers in a lot of the rest of the executive branch. In the USM, we need our workers to be trained on handling education data under the Federal Family Educational Rights and Privacy Act, known as FERPA, research data, financial aid data, and several other types of data that are not found broadly across the executive branch of government. We really need the flexibility for our training to be in the context of the educational environment. As another point, we are already required under existing provisions in the Maryland Code to have cybersecurity policies that are functionally compatible with the state of Maryland security policies. That includes cybersecurity education and training. Also, Senate Bill 588, cross-filed as House Bill 1122 and sponsored by Senator Kagan during the 2020 legislative session, already requires that the USM have a robust security program, and that bill will go into effect in 2024. Lastly, our cybersecurity training and education efforts are regularly reviewed by the Office of Legislative Audits and the USM Office of Internal Audits. With all this in mind, we're supportive of Senate Bill 107, but request an amendment that exempts the University System of Maryland from the bill. We need the flexibility in our training. We have existing requirements for compatibility with the state IT security policies, and we have existing oversight by OLA and our own Office of Internal Audits. So thank you for your time, and if you have any questions, I'm happy to answer them.
Thank you. Why don't you two gentlemen go to the row behind you if there are some questions. Let's bring up Mr. Fiore, Mr. Butchko, and then we'll take questions.
Good evening again, Mr. Chair, committee members. For the record, my name is Justin Fiore, Government Relations Manager with the Maryland Municipal League, here today supporting Senate Bill 107 with amendments. Again, I want to thank the sponsor for bringing this bill forward and continuing the conversation on cybersecurity trainings in the state. I think the intent and the framework of this bill is really good, but we would look for some amendments that both clarify it and maybe make it a bit less prescriptive so local governments can tailor it to their needs. With that, we ask for a favorable report with amendments.
Mr. Chair, members of the committee, Dominic Butchko with the Maryland Association of Counties. I would also like to thank Senator Jackson for putting this bill forward. This is just incredibly important, and today is Cybersecurity Day, and you all know that. In the interest of time, I'm just going to echo the comments of MML. We do support with amendments. We do understand the intent, but we do feel like this bill could be made better. Thank you.
Want to thank my former co-chair of the Joint Committee on Cybersecurity, IT, and Biotechnology
Absolutely.
for bringing forward a good bill. And I guess my question is, would you be willing to work with me offline to ensure that our two bills work compatibly, which I think that they do, but I just want to double check.
Look, as I mentioned in my testimony, I'm always willing to work with the committee to make sure that we're bringing forward bills that are best for our constituents. Look, we all know this challenge that we have here, and we've got to work together. Everybody has a lot of great ideas, so let's pull them together, and yes. So my answer is yes. Sorry, Mr. Chairman.
Thank you, Senator.
Absolutely.
Yeah, thank you, Mr. Chairman, and thank you, Senator Jackson, for this needed bill. And I just a couple questions. First one, so this bill would apply. It applies to state and local government employees. So does that penetrate into the legislature as far as would we as legislators have to be trained in cybersecurity?
Yes.
Okay. Yes. Okay. Great. Thanks. And is there prescribed training as far as the industry recommend for someone who are not, say, IT professionals, like we are here under this function? Is there like a 2-hour or 3-hour course? Is there something out there, and does your bill prescribe the form of training that we would need, or any other agency?
Actually, thank you for the question, Senator. The State Chief Information Security Officer would be required to approve and certify the trainings. And typically, look, I'm talking about the county's training, but that training takes less than 45 minutes that we have to do, twice a year, I think. So, yes.
Yeah, and so the gentleman from T. Rowe Price, so how long, quick question for you, how long would your training be for someone in your company, since that seems to be the model?
Senator, I regret to say I am unable to answer any detailed information about the training. I'm a lobbyist, and I listened with great interest to the legislation Senator Hester put forth earlier. I can't get those answers, but I can't provide those answers, but I can get them for you if you would like.
Okay, if you could, yeah, I appreciate it. Thank you.
I just want to make sure everybody understands that, again, we're all working together, trying to work together to get to, securing information in the state of Maryland. And again, that Chief Information Security Officer for the state, that person will qualify, whether it's T. Rowe Price or Michael Jackson or whomever else who wants to say, hey, my corporation or my company's already doing this, or USM. So that's where it comes.
That's right.
Thank you, Mr. Chair. I was just curious if the T. Rowe Price could do a cost comparison with the University of Maryland on the training that they offer and get back to us with that cost comparison. Thank you.
I will ask that question, Senator.
Completes the hearing on this bill. There's no one signed up in opposition. Thank you both.
Thank you, Mr.
Thank you,
Chairman.
Mr. Chairman. Thank you, members.
Thank you, Senator.
Committee. Thank you.
Ladies and gentlemen, we're on the last bill of the day, and I know a lot of you have been waiting patiently. I hate to say it, but some bills have to be last. So I appreciate your patience. We actually will be here some hours afterwards. We have voting to do. So we're moving to accessory dwelling unit, also known as ADUs, Authorization and Promotion Act. Senator Washington, this is Bill 871. We have a fair amount of witnesses, some in favor, some against. And I assume they're still here and in the audience. So let's have Samar Jha join Senator Washington, and Lisa May join Senator Washington. And then we'll follow with other folks in favor of the bill and some in opposition. Senator Washington, you're on.
Thank you, everyone. For the record, Senator Washington, I ask for your favorable report of SB 871. As ADUs, or accessory dwelling units, are typically small homes that have been converted or addition to existing homes with a separate entrance, and includes like a kitchen, a bedroom, or a bath. They can be in the basement, they could be a garage renovation, and sometimes they're even just a small little detached house in the back. Broadly, when we talk about them in the context of an ADU, we think of it as a smart housing solution, as they exist where homes and infrastructure are already in place. They allow local governments to increase their housing supply without spending a lot more on creating new roads and sewers and power infrastructure. For example, to build 150 apartments would take millions of dollars, right, and require many hearings and meetings and take many, many years. However, if you create the same 150 apartments using ADUs, it would be less than a year and without any taxpayer subsidies. One of the things of interest is that we used to really have a lot of these ADUs. Sometimes they would refer to them as mother-in-law houses or, cottage houses. And then at some point, they became illegal. And so what we're trying to do is to say, well, how can we reclaim this and use these ADUs as a way to create smaller homes that can reduce the impact of our local utilities on our environment and our climate? How can they be used to allow seniors to age in place gracefully and in their community and provide workforce and caretaker housing? So, for example, I could have my main house, and then I could have a live-in, but because I want my privacy, I don't want her actually in the house, but maybe you can convert the garage into a separate home. It's an affordable housing option. It's age-friendly. ADUs are able to be used by peoples of all ages. It could be a way of entry-level housing choices. It also could be a way to expand your primary home. It can provide empty nesters and others with an option of moving into smaller spaces. And so what this bill is doing is to authorize local municipalities who are looking, so this bill would offer a consistent guidance, state guidance, and consistency and leadership for helping local governments use best practices in utilizing these ADUs. Also, there's lots of questions and challenges that people would talk about, but these would be local laws that they would allow these they would establish what size they are. They would, well, I guess I should stick to who lived in an ADU? Fonzie. Do you remember Fonzie? Okay, so let's try to keep, I have all this stuff here, but let me just say that, so what it is right now, that they're illegal in a lot of places. You can't sort of set up sort of a separate detached place for somebody to live. And in fact, some places, I had a friend who had some in New York, and the law changed, and all of a sudden it became illegal to have these types of operations. And so all of the, the apartments that were set up separately, that was in the bottom of the house as a separate apartment, all of a sudden it became illegal. So she had to take out the kitchen, and take out some of the other utilities. So again, this is a way for us to address our housing crisis, to allow some flexibility, to even allow individuals to get some income, and all to do it legally. Because some of these are currently operating illegally. So there would be a framework for making sure that they are compliant with zoning codes, framework making sure that they're safe. But most importantly, they are just a way to help us address housing shortages, help us allow homeowners to expand their existing homes in a legal way. Now, that's sort of the big picture, general picture. The people that I have to the left know much more of the details about this, and that's what they will be testifying to. And so to talk about how the specific ordinance work, because it is a longish bill, because we are writing and creating a whole new section of the code. So I ask for your favorable report, and I look forward to hearing the discussion of my panelists. Yes.
Good evening, Chair Brinkley, Vice Chair Kagan, and members of the Senate Education, Health, and Environmental Affairs Committee. My name is Samar Jha. I am a senior legislative representative at ARP's National Government Affairs team. I am speaking to you on behalf of over 870,000 ARP Maryland members. AARP Maryland and its members support Senate Bill 871, which relates to a statewide authorization of accessory dwelling units, or ADUs as we call it. We would like to thank Senator Mary Washington for her leadership and for supporting this important piece of legislation, which is now being discussed throughout the country at the federal, state, and local level. I'm speaking to you today to emphasize the importance of ADUs as a viable, affordable housing option for all ages. I have submitted my written testimony. However, as part of the oral testimony, I would like to address some important issues here. As mentioned earlier, Senate Bill 871 proposes to authorize the development of ADUs on land zoned for single-family residential use, subject to certain requirements. AARP supports the availability of ADUs as an affordable, accessible housing option for all ages. ADUs are small houses or apartments that exist on the same property lots as a single-family residence, but still provide separate living and independent quarters. And because they tend to be smaller and more affordable than single-family houses, they can be a good housing option for older adults who want to downsize but still live in a neighborhood setting. AARP's 2021 Home and Community Preference Survey indicates that nearly 60% of adults would consider living in an ADU, and nearly 3/4 of those polled said that they would create an ADU for a place for a caregiver to stay. The survey also indicated that more than 80% of the respondents would consider building an ADU for their loved ones, relatives, and friends, therefore emphasizing the multifaceted use of an ADU. Furthermore, the current ongoing pandemic has exposed the vulnerability of older adults and have made us realize the importance of ADUs, as they can provide a safe, comfortable alternative to housing. ADUs can fill a number of roles that you may never have needed before, like providing a place for your aging parent to live instead of a nursing home, or for an adult child who may need to return home after college or has lost a job, or for many life-changing moments, or can be used for additional income for someone on a fixed income. According to Statista and AARP analysis of data available by the census, in the state of Maryland, more than 2,800 older adults who are aged 55 plus faced evictions, and more than 4,400 older adults aged 55 plus experienced homelessness in 2021. Unfortunately, in 2022, over 11,000 older adults who are aged 55 plus are expected to be evicted, and over 6,000 older adults 55 plus are expected to experience homelessness in the state of Maryland. Senate Bill 871 will help in easing the housing supply and assist in lowering the eviction and homelessness rate by providing affordable housing to the residents of Maryland. Before I close my testimony, I would also like to briefly address certain issues that were raised in the fiscal and policy note for Senate Bill 871. According to the fiscal and policy note, it states that local revenues are expected to decrease due to bill's limitation in collecting development impact fees, building excise taxes, and water and sewer connection fees. However, it does not talk about how much of the revenue they would be collecting if there's development happening, and also property tax increasing. So you may want to also evaluate the revenue collected through building of ADUs. I would like to thank the committee for providing me an opportunity to talk about the importance of ADUs as a viable housing option and how it will provide the residents of Maryland affordable and accessible housing. AARP Maryland is committed to working with you to effectively address the state's housing option for older adults. Thank you again for allowing us to submit testimony in support of Senate Bill 871. We ask the committee to issue a favorable report on Senate Bill 871. Thank you once again.
Thank you, Mr. Chair and members of the committee. Lisa May with the Maryland Realtors, representing 30,000 real estate professionals in Maryland. ADUs are a realtor priority this year as part of our Open Doors to Stronger Neighborhoods campaign, which seeks to find solutions to our 82,000 unit housing shortage. In our written comments, you will see the initial results from our State of Housing poll that we conducted in January of Maryland residents. And that poll found that 67% say that there's too little housing for lower income residents, 67% too little for young people, and 59% too little housing for seniors and those with disabilities. Accessory dwelling units are a logical solution to finding housing for all of those groups. But unfortunately, we don't have uniform standards to add ADUs across all of our counties. In some, it's so difficult, or there are so many fees added that it's really not practical, and in some areas, they're just not permitted at all. We think this bill will help average homeowners modify their properties to suit their current needs and the needs that we are seeing in the real estate market. And if I can leave you with one thing, our poll found that 76% of Maryland residents agreed with that sentiment, that it should be easier to construct ADUs in our state. So with that, we strongly urge your support of this bill.
Thank you, Mr. Chairman and members of this committee. My name is Alderman Brooks Schandelmeyer. I represent Ward 5 on the Annapolis City Council, and I'm here to strongly ask you to support this bill, SB 871. I was the lead sponsor and shepherd of Annapolis's own recently passed accessory dwelling unit bill. It was something very personal to me because I actually got my start in Annapolis by living in any off-the-books accessory dwelling unit. I don't like to call these things illegal because it was a family providing a young professional who went on to work in the General Assembly with one of our colleagues here now and actually represent his community on the City Council because I was able to get my start here with an accessory dwelling unit. Now, it's a great story. What does that have to do with why should the state get involved with what's normally seen as a local government issue? I say this somewhat provocative statement, but I mean it fully. Local governments are completely uninterested to solve the housing crisis. We are very often dominated by people invested in the status quo. We are rewarded electorally by what housing we stop rather than what housing we allow. And unless the state intervenes on this very small thing that would allow accessory dwelling units to be built statewide, we will continue to have this housing crisis. All of our goals that we put forward will just be talk. The state can actually do something about it and force local governments to follow through on the housing promises that we keep making. Thank you.
Why don't we have a couple of you move back a row, and then we'll take the next couple of people, and then we'll open up the questions. Ms. Graff, Ms. Margolis, and Katie George, if you're in the house. Then we'll take questions for the sponsor and all the witnesses. Then we'll move to the unfavorables. Ms. Graff.
Great. Good afternoon, Mr. Chair, Ms. Vice Chair, and members of the committee. Glad to be back in front of the committee this evening. For the record, I'm Lori Graff. I'm CEO of the Maryland Building Industry Association. We represent over 100,000 employees in the residential construction industry. I'm here to ask for your support for Senate Bill 871. As you've just heard, and I'm sure you've heard from many pieces of legislation that we've been in front of you for, Maryland has a severe housing shortage. We must out thousands of units by 2030 to accommodate our growing population. Most of these units need to be for low-income and moderate-income individuals. There is no question, and we should all agree, we need more housing that's affordable for Marylanders, all Marylanders. Additionally, home prices just continue to increase. For example, in Montgomery County, prices increased 14% last year, and for the first time, the median home price topped $500,000. For a single-family house, it's nearly $800,000. This isn't unique just for that jurisdiction. Jurisdictions across the state are really struggling with rising home prices. What all these places have in common is a chronic shortage of new home construction, particularly for lower-priced homes. The building permit number, I just pulled the number for last year, statewide, we only had 18,000 building permits. We're never going to get to our goal if we don't increase our tools that we use to help increase housing. Accessory dwelling units have the potential to increase housing affordability, create a wider range of housing options within the community, enable seniors to stay near family as they age, and facilitate better use of the existing housing fabric in established neighborhoods. States and cities, you just heard about Annapolis, Montgomery County has adopted this in 2019 as well. And then places such as Vermont, Connecticut, California are all adopting these accessory dwelling units as a way to, as just a tool for many tools that we will need to increase our housing and to decrease housing pricing rises. This bill does have several different guardrails in it, but with that, we'd like to ask for a favorable report. Thank you.
Hello, my name is Susan Margulies, and I'm an utterly insignificant homeowner who is just here to speak in favor of this bill on behalf of other insignificant homeowners, single women homeowners, young families, widowers, people who are trying to age in place, who have been able to claw their way into one asset. They have one home, they have one asset, and when hard times hit, they have to be able to monetize that asset. And that's what an ADU does. Whether you Airbnb it, whether you put it on the market as a long-term rental, if you need a new roof, if you need a home for your aging parent that you don't want to put them in a nursing home these days with the pandemic where you may not be able to visit them for months in a row because of quarantines, having an ADU on your own property can allow you to provide for your family, get extra money coming in the door for educational opportunities for your children. It can let you keep your home in good repair. It can help keep you afloat if you lose your job, whether you are short-term renting to doctors or nurses on 2-week rotations at Anne Arundel Medical Center, whether you're short-term renting to Navy families, whether you're long-term renting to students at St. John's College, being able to monetize that one asset that you've been able to, by luck and hard work, claw your way into. This ADU bill is so important, and on behalf of tiny homeowners, insignificant people all over Maryland, we need your help because local politics is driven and dominated by strong, powerful voices, and we need your help to get this ADU bill through so that we can rent rooms on our property and help us through hard times. Thank you.
Thank you, Mr. Chair, Senator Washington, committee members, and guests. My name is Katie George, and I reside here in Annapolis, Maryland. And I'm here today as an advocate of more affordable housing alternatives in Maryland, especially ADUs, and obviously to ask for your support of SB 871. I started my ADU journey as a chair of the feasibility committee for the Annapolis Housing Affordability Task Force last year. But more importantly, I've also owned an ADU and experienced firsthand how financially beneficial having an ADU was for me. I was a divorced mom back in Texas with 2 preschoolers when I purchased a 1930s home, mainly because it had a little house, or ADU, at the back of the lot. The documentation for a long-term rental income stream made me eligible to buy the home at all. For 5 years, I rented variously to a new lawyer, a student couple, and then a part-time hairstylist. That rental income helped me defray my mortgage costs. Then, for the next 5 years, our little house allowed my elderly mother to live on-site with me and her grandchildren. So yes, I personally know the advantages of having an ADU when you have limited financial resources. Here are 10 reasons why I believe ADUs are a good idea for the future of Maryland. They can provide needed housing to address rental stock shortages in urban areas of Maryland. They allow existing homeowners to optimize the highest and best use of their own property. They increase the property value and resale of the primary residence for the property owner. They encourage multi-generational family units on one site. They serve as cost-effective private guest accommodations for visiting family and friends. They support home ownership by allowing for a potential long-term rental income stream to help defray mortgage costs. They provide an on-site private workspace for remote workers in a post-COVID world. They give housing options to young, senior, or disabled populations. They do no harm to our environment. And finally, ADUs are a permanent long-term dwelling solution that increase housing options to those who need it most. Thank you for allowing me to appear, and I urge your favorable reporting of SB 871.
Sure. Thank you, Mr. Chairman. A question for, and this may be for the prior panelists too. So I'd been reading a book over a period of time about redlining in Baltimore, and it struck me that, you know, obviously there's been a lot of gentrification going on, and even the pushback against ADUs, from my perspective, seems to be a perpetuation of this gentrification too, that it's people that have, been privileged in some ways to be able to purchase a house and don't want to allow other people to move in or to have more people to move in. And as the alderman kind of mentioned, that local governments will always be resistant to this because they have a natural incentive to to bring up home prices, I think, for those who already have homes. And so, is this an effort, is this something that you view that only the state can take up because of that resistance that's inherently present from local governments and local communities? But ultimately, I think, from my perspective, is something that really helps with affordable housing and helps break some of those gentrification and redlining barriers.
So as you know, we sit on the Joint Committee on Ending Homelessness, and for the last 4 years, actually the last 8 years, we've talked as a state about the housing crisis. And we talk about, we've done things around evictions. We've tried to put some more money, not enough, but into rapid rehousing. But we continue to face barriers in actually building enough units of moderate income housing. So I do think it's is a responsibility for us as a state, because we've been watching this and not seeing enough action at the local level. But I also believe that there are locals who would want to do this. And if we show this leadership, it can empower those that want to do it to do it. So that's where I see our use of the land use code and moving forward, our responsibility to ensure the proper land use.
Does the alderman want to respond to that?
Yes, thank you. Is it okay?
Gotcha.
The answer's brief.
I'll keep it short then. Yes, adding to the housing stock, as shown by a couple recent studies, and most famously in the book, The Affordable City, The Affordable City by Shane Phillips, has shown that adding to the housing stock, especially with these gentle, locally produced density measures such as accessory dwelling units, has been positive in combating gentrification and pushing out older residents, because when the stock of housing remains the same due to an artificial scarcity of supply and demand in a growing population state like Maryland goes up, housing costs go up and pushes out those families that grew up there. So by adding the stock in, you can help push down on overall prices by addressing the
And I
demand.
presume then the bill sponsor says that this would be probably the nudge to make that happen. And I think, personally, I think it's a win-win all around. And really, kind of the only folks that would be resistant would be some of these local communities or folks that would be naturally resistant to seeing more homes anyway in that area. So, thank you.
The resistance to this at our local level did tend to come from wealthier communities invested in the status quo.
Right. Unsurprising. Thank you.
I have to ask a couple questions. And again, I understand in urban areas where housing is very short. I'm reading the bill on page 5. It says, a local law shall require that the total square footage of the accessory dwelling unit be less than the total square footage of the primary dwelling unit. That's not necessarily a small house. I mean, if you've got a 2,000, 3,000, 4,000 square foot house, I mean, and you have a big yard, a big property, you can have a 3,000 foot house behind you. I mean, that's not the concept I have when I think of an ADU. I think of a urban or near urban situation where you've got a little space and on top of your garage, you build it for a son or daughter or grandparent. I mean, this is pretty humongous language, and hopefully we can
tighten that up. Yeah, because you're right. In section 4-506, we talk about 750 square feet, and so there are a couple places where there are. So I'm happy to do that.
And I have to say, expanding housing, I strongly believe in. But the one witness who's talking about having all these ADUs so you can do Airbnb. I don't care whether you live in an urban situation or a semi-urban or a suburban. If you have 10 people on a street who build a little house so they can have people coming and going every 2 nights or every 5 nights, I mean, this issue with Airbnb in communities is being debated anyway, of where they should be, where they shouldn't be, should they be in hotel zones or motel zones, or should they be everywhere? Some of us haven't chosen to be in areas where there's a lot of transiency. You know, so if that is one of the impetus for this, I have to tell you, I personally, I'm not sure, wherever it is, that's driving this. I mean, I hear the issue of shortage of housing, family or other people starting out, you know, who need a year or 2 years, whatever, and, you know, in 750 feet or 600 feet, square feet, you know, these small mini homes, these mini units, there's another name for them, but I know they're hot a lot of places. But if one of the impetus is just more opportunities to monetize and run Airbnb, it raises concerns for me, and I'm just speaking for myself.
And you know, again, I respect the woman that testified, but that is not, it's not part of the primary panel. That is not what I would suggest. That the monetization had more to do with, for example, you live in a large home, you have one, you can build one of these smaller properties. Maybe you can move from your actual home to this property and then rent out your main home, you know, or you could rent out the building. I see it as a long-term rental. I'd be open to directing around some of that. But, you know, people buy islands and rent them for Airbnbs, and so it's kind of difficult to control that part, but that is absolutely not the motivation behind this legislation.
And Mr. Chair, if I could add, I think certainly, the data suggests that there's not going, wherever legislation favoring ADUs is passed, it's not like everybody builds an ADU. Generally speaking, there's like maybe 1 in 10 homeowners who take advantage of it. So the misconception that they're going to be strangers running around your neighborhood is probably misplaced.
When you said policy,
Yeah.
well, I'm familiar with ADUs. I think we all read about them, and it's, you know, they've been written about for about numbers of years. We understand that. We also have to think of the policy for the state in all conditions. Senator Ellis.
Yeah, thank you, Mr. Chairman. And Senator Washington, I serve with you on the Joint Committee for Ending Homelessness for, I guess, my 4th year now, and I see your commitment to this issue and through that platform. And thank you for this bill. So would you be willing for us to put guardrails around this bill to say that maybe these ADUs, auxiliary, what's the term, what's the definition of ADUs? I hate to use acronyms, but I hate acronyms, so.
Accessory dwelling unit.
Yeah, accessory dwelling units,
Yes.
ADU, accessory dwelling, okay. So they cannot be over, say, X% size of the main house. So we can say, hey, you know, like the Chairman mentioned, you know, if a house is 3,000 square feet, you build this, a accessory dwelling unit at 2,900 square feet, right?
Sure, right.
That would kind of violate the idea behind this. And also, would you be willing to do that?
Yes, no, I can see where we do it on page 5, yep.
Percentage, yeah, and say maybe 1/4 of the size, whatever the size is, or whatever, not particular number. And also, would you be willing to put in a amendment to say that these units cannot be used for short-term rentals, a week or month? That's typically used for Airbnbs. So it will be definitely used as housing for individuals for permanent homes instead of just a
I don't know that
excuse.
we could do that level, but I do think we can do some uncodified language that talks about recommending that the local laws that are adopted ensure that these are residential, you know, I think we can do something to that effect. We can't, you know,
I'm sorry,
I
go
like
ahead.
to push it as much as you do, but I'm pretty clear we can't you know, we can't.
Yeah, I know some counties in Maryland have laws that limit how long non-relations
Right.
can basically be a roommate in a home or whatever, non-family members. And I know Howard County have laws like that, because I have family in Howard County, so, you know. But there are those laws that restrict, folks running out their homes to unrelated folks for over, I'm not sure, 3-4 months, something like that.
Okay, thank you. Okay,
Thank you.
no more questions. Let's go to the opposition. Mako and MML. And Angelica Bailey and Dominic Butchko.
You want me to start? All right. Good afternoon, everyone. Angelica Bailey for the Maryland Municipal League. This is actually my first in-person hearing since pre-COVID and my very first with MML. So it is truly a pleasure to be here. Thank you very much for your time and consideration. Very quickly, MML and Mako are very much opposed to this bill, respectfully opposed. Our position isn't based on the drawbacks or the merits of accessory dwelling units. It's really more about process and pragmatism for us. This bill proposes a mandate on local governments that would override our ability to make appropriate zoning decisions for our neighborhoods. It's no accident that zoning decisions are made on the local level. Our folks are on the ground, we know our communities, we know what they need. We have the knowledge necessary to make those decisions. And a lot of that knowledge comes from long-term planning. That's a lengthy and substantive process. It incorporates lots of stakeholder and constituent input and collaboration, and this bill would wipe all of that away, which is really too bad because our communities are incredibly diverse and that local input is crucial. There are 157 municipalities in the state of Maryland. They vary in terms of population, demographic, topography, personalities, really. And blanket mandates just don't address those complex and diverse needs. Local governments need the flexibility to do their best, and a one-size-fits-all uniform standard approach just doesn't work here. So we very much appreciate the sponsor's intent, but we are opposed to this bill. Thank you.
Dominic Butchko here with the Maryland Association of Counties. Mako respectfully opposes and echoes definitely what MML just said. I want to follow up, though, and add a little supplemental to this. So I met with our county planning directors, almost all of them, and almost all counties authorize accessory dwelling units in some shape or fashion. It varies across 24 jurisdictions, but recently Montgomery County just updated their accessory dwelling unit laws, as well as several other counties, and there has not been an incredible influx of people trying to install these. When we do see local governments going and creating very liberal policies, there's not a ton of people rushing to do this. So again, I want to echo everything that MML said, but when our locals do this, it's not like it's not the one size fits all, it's not the silver bullet that this is played up to be. So again, in respectful opposition, thank you.
Questions for the opponents? Seeing no questions, thank you. Thank you for your patience. Thank everyone for staying. Get some dinner. I think that brings us to a close on our hearings. We're going to go into a period of voting. People need I know people want to get rolling because they have other events. Do they need to stretch or hit the bathroom? Look, literally 2 or 3 minutes. Don't leave the room unless you're going that way in the back to the bathroom or the break room. Do not go towards your office.